Every Saturday morning on The Big Issue from 9 a.m. to midday, we empanel a rich set of brains to help us discuss the big stories of the week. And I always say that if the stories are big, they make it onto The Big Issue. And trust me, this is a place you can get a second opinion on a story that you've had your own opinion formed about throughout the week. If you were too busy, you couldn't get the news, well, this is where you can get the summary of the top stories. And we'll be challenging the status quo and also questioning the people who have to be questioned, and also getting you the dispassionate views. So I'll be introducing my panelists in a bit, but before then, let me tell you what we are talking about. The issue of no bed syndrome is back in the news. It was there some time back. We were told that an attempt had been made to fix it. It appears that we are still having the same problem. So we'll talk about the no bed syndrome. Then we'll connect that to the baby that was stolen at the Mamprobi Polyclinic in Accra. A baby theft has happened in the past. It took us by surprise. It took us by storm. It was major headlines. We complained, we talked about it, and after that, everything has gone down. We're going to focus on security at our hospitals. How easy is it to get into a hospital and out of a hospital, and even generally some of our government institutions? That's something we'll be discussing this morning. I have a doctor in studio who would help us with that conversation. Then we'll be going to Burkina Faso. Poor innocent traders decided to go and buy tomatoes. The fight between the government of Burkina Faso and the rebels there led to the death of 8 people who were shot. They were simply caught in the crossfire. The root question would rather be, why do we have to go and get tomatoes from Burkina Faso when we have the Volta River with the white and black waters, the Pra, the Ankobres, all of these ones? We have irrigation system that we can simply do and then have tomatoes. Why do we have to travel to Burkina Faso to collect tomatoes for us to even be facing the challenge that we are facing? So that's something we'll talk about. And then on the legal front, you remember in the early days when Chief Justice Gertrude Tokonu was removed, the MPP and a lot of critics of the NDC government said this was a settings and that it was a beginning of many things to come, and that the chairperson of the Electoral Commission was going to be removed as Jane Mensah. And then the Office of Special Prosecutor's head, the Special Prosecutor himself, Kisi Ejabi, was also going to be removed. Well, we saw petitions that were sent to the president, which president forwarded them to the Chief Justice. Everybody said, there's the same playbook, they're going to remove these people. This week, the Chief Justice returned a verdict and said, not guilty. Well, he didn't use not guilty, but no prima facie has been found. What prima facie simply means that on the face of it, he hasn't found enough to warrant even a probe into the claim that has been made against them. And for that matter, Jane Mensah retains her job, Kisi Ejabi retains his job. So we're talking about that. Was it much ado about nothing? Is this government agenda? Is it something that has been done properly and constitutionally and worth celebrating? That's something we'll be talking about later in the discussion. But before then, we're going to start with the issue of the baby, the happenings at the health sector. So 2 weeks ago, 29-year-old Charles Emisa, a hit-and-run victim at the Nkrumah Circle Overpass in Accra, was reportedly denied emergency care by 3 major hospitals due to a lack of available beds. Now, Health Minister Kwabena Minta Akando has since ordered an investigation into the circumstances surrounding this death. He himself is chairing that particular panel. We have a timeline of events here for you on this no bed syndrome matter. Watch.
On Friday, 6th February, a 29-year-old Charles Emisa died following a hit-and-run crash at the Circle Overpass in Accra after reportedly being turned away by 3 major hospitals due to the unavailability of bed space. The victim was an engineer at Pomisado Ghana Limited. At 10:32 p.m., the ambulance service received a walk-in alert about the incident. According to the service, the crew mobilized a minute later and arrived at the scene 3 minutes later, where Emisa was found lying supine on the road with profuse bleeding. At 10:40 p.m., the ambulance departed for Police Hospital, arriving 3 minutes later. The facility reportedly declined to admit Emisa, citing no available beds. Even the offer to use the ambulance trolley was reportedly rejected. The crew then transported the patient to Ridge General Hospital, arriving at 10:58 p.m., where he was again refused admission. At 11:20 p.m., the ambulance reached Kolebu Teaching Hospital. Staff there allegedly instructed the crew to continue to the University of Ghana Medical Center. While still at Kolebu, Emisa's condition deteriorated, and he went into cardiac arrest. CPR was administered immediately, but was unsuccessful. A doctor on duty later certified him dead and instructed the ambulance crew to convey the body to the mortuary. The EMS team transported the body at 12:50 a.m., handing it over to the appropriate authorities at 12:53 a.m. The Deputy Director of the Ambulance Service, Simon Yusuf Kibra, confirmed the sequence of events to City News. He also lamented the negative impact of the no-bed syndrome on their work. He further called on health authorities to find lasting solutions to the challenge.
So everything brought down to the no-bed syndrome. So it's something that we are facing. But this particular issue is an emergency case that happened at a spot, and we need immediate attention. We don't provide holistic medical care. First is to provide free hospital. So ensure that the person gets to a facility for further treatment. So if we get them, there's no bed. In fact, it makes our work very less. So we always appeal, we want the government to at least a percentage of at the emergency ward.
There are also reports that some of these hospitals deliberately refuse to accept the person due to the condition of the person and not necessarily because they aren't bed. Has that come to the attention of the ambulance service as well?
That's one, I cannot establish that. And then because of all this, that is why the minister has established and has formed a committee to look into this matter.
So that's the issue of the no-bed syndrome, and this is coupled with the theft of a baby. Another thing that happened in our health sector. Let me tell you about that one too. Latifa Salifu has been arrested and remanded into police custody for 14 days by the circuit court in Accra. And this is because she allegedly stole a baby, 4-day-old baby that is at the Mamprobi Polyclinic. Here's a report.
33-year-old Latifa Salifu, who appeared in court on Friday, for the first time pleaded not guilty to the charge of stealing. She was in court after she was accused of stealing a 4-day-old baby at the Mamprobi Polyclinic on Tuesday. Though the baby has been reunited with the family, police say Latifa Salifu will face the law. She has been remanded in police custody for 14 days and will reappear on March 4. Meanwhile, Health Minister Kobna Minta Akando has paid a working visit to the Mamprobi Polyclinic following the incident on Tuesday. The minister urged management and staff to strictly comply with directives issued by the Ghana Health Service, stressing that identification through name tags for both staff and patients must be enforced at all times within health facilities.
Is that apart from the tagging, which is part of the clear protocols of identification of patients and in this case babies, name tags should not be taken off at the ward level. Name tags, both the parent, the mother and the baby, should be taken off at the security gate at the exit. That's why you take the name tags off after going through all the protocols, settling your debts, and you are exiting the health facilities. That's where the name tags must be taken off.
He also called on medical institutions across the country to strengthen collaboration with nearby police stations to enhance security and ensure swift response to emergencies.
I've directed the Director General that every health facility must have some kind of relationship with the immediate police post. So the police must even be patrolling here as and when, or at the click of a button, must get access to them. So there must be that relationship. We have directed one of one, and the name cards, the CCTV cameras, they must always be working.
The Member of Parliament for Ablekuma South, Alfredo Cope Vanderpoy, appealed to the Minister to support the expansion of the facility's labour, postnatal and recovery wards to improve security and service delivery.
request me to expand this all the way to also the so if we can expand this to change monthly fees, actually from a central, it's my way of the world, so much
As part of the tour, the health minister visited the mother and baby involved in the incident, who are currently receiving treatment at the Kolebu Teaching Hospital.
So that's a report of what happened at the Mamprobi Polyclinic, and also you've heard the story about the situation with the no-bed syndrome. Let me introduce my panelists in studio now. I'm going to start from the first person sitting closest to me, and I have a number of doctor titles in studio this morning. So I have Dr. Ishmael Norman. He's a security analyst. Doc, you're welcome to the big issue.
Thank you, sir.
Is your doctor a book doctor or a medicine doctor?
Purely book.
Book?
Public health.
My mother won't like you. My mother believes that a doctor should be able to inject and give medicine.
Oh.
So if you are not doctor, you are not doctor. You should be wondering what kind of doctor.
I inject knowledge and wisdom.
Oh, okay.
Oh, yeah.
Nice to meet you. You're welcome.
Thank you.
The next person I have on my guest list in studio with me is a politician. He left a very vibrant party. I went to start or something. I don't know. He and his boss. He's a lawyer. His name is Andrew Apia Dankwa with the United Party Plus.
UP Plus, yeah.
You're welcome.
Yeah, thanks, Umaru.
I always say to you that thing be wrong thing you went to do. Leave it to do.
No, it's a very good thing.
It's a very good
thing. If you look at politics.
No regrets.
No. If you look at politics broadly and why we ought to do politics, it's a positive step.
Okay. All right.
A very good one.
Very well. My next panelist, he's a medical doctor. He decided to run and go and do politics. But the people of Teshin, they have this notoriety of never retaining a member of parliament. So when they elected him as member of parliament for Lejo Kuku, after one term they changed him. President Akufo-Addo, in the dying areas of his government, made him a minister. But then he and everybody went home on retirement. Dr. Bernard Okobo, he's a footballer. He does keep fit on the weekends and does clinics in his constituency. You're welcome.
Hey, Umaru.
I am sorry.
The most mischievous guy in town.
Oh, but
you have changed.
Everything I've said is accurate.
Almost.
How is the consensus?
Oh, my grace.
Did you go to the beach this morning to jog or play ball?
Today I trained indoors.
Okay, you did indoors.
Because I was coming to meet big men.
Oh, you become Dadaba now. You have a gym in your room instead of going to play with the boys.
I mean, as you grow, you learn some things.
Okay.
That not all can be external.
Okay.
You try to internalize some.
Hey, dog. It's good to see you.
Yeah, good to see you too.
Okay, another guest. He ran away from the medical profession. He was a medical doctor. Okay, he's still a medical doctor. He was in charge of the Ridge Hospital. There was lots of controversy. I don't know what happened. One day he decided he's going to be a member of parliament. So he went to the people of Garu in the Upper East region and said to them, please make me your MP. And they agreed. Dr. Thomas Anaba, you're welcome.
Thank you very much.
How are you doing?
I'm doing very well.
I've accurately described your portfolio, right?
Yes.
Do you still do private practice? I know lawyers who are at parliament are able to go to court and do things if the speaker agrees. As doctors, can you go and do locum?
Yes, you can go and work if parliament gives you the permission to go and work, make profit.
Oh, okay.
Yes, so we've applied. We are waiting for the approval. I'm told they've started giving the approvals where they deem fit.
Okay.
So I'm waiting to see whether next week, if I go, I'll see my approval letter.
I see.
Then I can go back to practice. But I still give these consultations, free consultations on my phone.
So. But how will you do the two? Because now these days parliamentary people sit late in the day. Are you sure you can manage the two?
If my hospital was to be in Accra, because we start at 2 o'clock, I could work in the morning and then go to parliament. But now that my hospital is in Tamale,
okay.
Unless maybe I'll go and register with one private hospital,
okay,
or government hospital.
Your hospital is actually very close to Parliament. It's called Ridge Hospital.
Oh, that was where I worked before. You know,
they do public service, private, free Ubuntu.
you know how people may feel, and then the rest. I want to be objective. Going there to do any locum would cause maybe some problems.
Even if it's for free.
Even if it's free, people will read minutes to it. I better go to the general hospital when they finish.
Okay, but when you were MP, a minister, you used to go and do Monday something at Lekma.
I was doing at Lekma.
At Lekma Hospital. It's allowed. As member of parliament, you were given the clearance to do
yes, yes. I mean, once you've renewed your license, like you are on the roll, and you sit with the hospital management, especially when they know you, like they will not pay you, it's for free. They will be in a hurry
to take you on.
Yes, yes.
Let me go via Zoom and introduce Dr. Kwame Esedu-Sapon. He is a CDD research fellow in public health. Sir, you're welcome to The Big Issue.
Thank you, and good morning to all panelists.
Hope the week has been good for you on a personal level.
Busy, but we soldier on, is all I would say.
That's nice. That's nice. Thank you so much for joining us. We'll be joined also by Franklin Kujo, who is president of Imani Africa. He'll be joining us via Zoom. But let me start in studio. Let me start with Dr. Anaba. You have risen on the health ladder to the top of a hospital, a regional hospital. Ridge was a regional hospital.
Yes, please. Yes.
I spoke to a doctor over the weekend who said to me that the issue of the no-bed syndrome is an attitude of doctors.
Yeah.
He told me how many years ago he was at KNUST, there was a directive that said you should not treat patients on the floor. Now, subsequent to that, he's saying that that's one of the reasons. But he also said that there's simply an issue of attitude of doctors where the doctor is not interested in helping. They want to go and sleep in the night. Or the nurses simply don't want to accept anybody because it will affect their sleep. You have dealt with the human resource, the medical resource, all of that. Talk to us about this no-bed syndrome. What really is the problem?
Thank you. Omar, I think the no-bed syndrome particularly raises its ugly head when it comes to emergency cases. You hardly hear of it very much when it comes to referrals or outpatient. Most of the tragic incidents we've had in hospitals where patients lose their life because of there's no bed is when they are brought to the emergency and the emergency has no space. That is where the problem is. It appears to show that our management of our emergency departments are not properly conducted. One, any patient per protocols, any patient who gets to the emergency department must be triaged, identified, and given a color code depending on the severity. He sees a doctor immediately. He can wait for 30 minutes. He can wait for 1 hour, or he can be referred to the OPD, outpatient department, to be attended to.
This determination is done as soon as the patient arrives?
Patient arrives.
Who does this?
It is the triaging nurse.
Okay.
Then from there, a doctor is called where the need be. I'll come to the colors I've explained to you. Okay. So let me continue. And then no one should stay at the emergency department after 24 hours.
Okay.
After 24 hours, you are either moved to the ward, you are moved to the intensive care, or you are going back home. If there is no space in the hospital to take them out of the emergency department, there should be a coordination between all close by hospitals to see whether they have a space for that particular patient and they have the capacity to treat that patient.
A patient must not be in the emergency ward for more than 24 hours.
4 hours. The reason is that is a transit point for you to be stabilized and then move to the next level. You may be moving straight to theater, after that to ward. You may be moving straight to a ward, or you may be moving to another hospital. But you can't stay there for more than 24 hours. It is simply because we don't manage these cases very well at the emergency. Sometimes they'll say there's no space at the ICU, there's no space in the ward, and then the rest. That is where we have this. But let me tell you, there's a guiding principle. There are guidelines governing emergency department. Coming back to the case that we are talking about, and I don't like to speak on my own. I would like just to read some few lines from the guidelines. The guidelines is from the Ministry of Health, Emergency Accident and Emergency Services, 2011. And that is the Ministry of Health, Accident and Emergency Service Policy and Guidelines. It says, and I'll read, Triage team should assess all patients presenting at accident and emergency department. Triage teams. And triage teams are either made up of nurses or doctors, depending on the level of the hospital. They didn't say a patient who is referred. Anybody who presents, whether he has a small toothache, he has a small headache, he has a big wound, he is gasping for breath, he's in shock, the person must be triaged. That is what it says. So no one has the right at the emergency to turn out a patient and say, go to the next hospital.
Yeah, but the point is that if you accept the person has to go through the system and you know that at the end there's a clog, so what's the point of accepting?
It doesn't matter whether there will be a clog or not. That is where we have the problem. They said they must be triaged. And the next step is, it is not me.
And this triage, is it done in the ambulance or you are brought to
You are brought down.
Okay.
The triage nurse doesn't go to the ambulance. Okay. You must be brought down to the nurse at the entrance of the emergency or the doctor, depending on the class of hospital. Then you are assessed to see your vitality. That is why they give you a red coat, a orange coat, a yellow coat, and a green coat. A red coat means you can die in 5 minutes.
Okay.
A yellow coat means if you don't attend too quickly, in 30 minutes, you can get complicated. That is an orange coat. And then a yellow coat means that you can wait for maybe 1 hour, 3 hours. And then the green coat means that you can even wait till 24 hours, or you can go and see any doctor at the normal OPD. Why did they do this? To make sure that anybody who gets there gets the quick attention, gets sorted out to determine his gravity. So to tell a relative of a patient that take him to the next hospital without going to see, I want to educate the public and then remind my colleague doctors and health professionals, this is unacceptable in the first place. No matter the circumstances, you are first of all having to try the patients. If you see that he can die in 5 minutes, the doctors have the right to abandon any patient they are treating as yellow and attend to a red. The doctors, they have the right to abandon somebody who can survive without treatment for 4 hours and treat somebody who will die in 5 minutes.
And they know this.
They know this. That is why I say I'm reminding. They are my colleagues. I'm reminding and I'm educating the public. So we all get this thing in our brains.
Does it mean then that if I come to a hospital, I must be admitted at that hospital even if they don't have the capacity to admit me based on their infrastructure needs?
What did I tell you from the beginning? A patient should not stay more than 24 hours at the emergency.
Yeah, but I'm looking at...
Meaning that even if there is no space, you must be triaged. One. And you must be... a doctor must be assigned to you if you are in danger to die. A doctor can also be assigned to you if you are at an orange. Depending on the cases they have. You can decide to do forced transfer of those who are stable to the nearest hospital. That is why you have the 24 hours. Anybody at the emergency, they can either go to ward, theater, ICU, MOC, or be referred to another close hospital. Those who can move without repercussions on their disease, the transportation would not cause problem on them, can be moved. If you think that my emergency is full, but there is space in the ward, I can move somebody. That ambulance that brought this person, you might have coordinated with all other hospitals that are close by to move one person out of the hospital to take the one that cannot move out. Yes. Or as the minister said, you can decide to put people on chairs because they can sit on it, but others cannot. Because you can't play with the patients who is red, yellow. Orange you can play a little with. But yellow you can play a little bit with. Orange and red you cannot.
These things you say are the ideal situations. Have
you
thought of what happens at night, midnight, 1 a.m., 2 a.m.? By then, there are very skeletal staff around. A lot of the time, most of them are hiding in their rooms, sleeping.
This is where you come, and I don't agree to, that there are skeletal staff, there are this. That is the problem we all have created. This is the problem we all have created. And if we want our emergency department to work, and we have designed, we have drawn guidelines and policies on how to manage emergency cases. It's not me saying it, it's for the Ministry of Health.
Since 2011?
2011. And luckily, I was a member of the team that designed this. Okay. And I know it outright down. And I know what they're supposed to do there. And they know. We educate, just that we have to follow up and remind them. Look, challenges at emergencies exist in every country, even the US, even in UK, even in Russia, China. There is problems at emergency. But you must prioritize using this guideline. If Mr. X came with asthma, has been nebulized, and he's feeling better, you can give him a chair to sit and put somebody there. You don't also put a patient at the emergency because of critical conditions and keep him there for more than 24 hours. Or else you'd cause the doctors there to get exhausted. That is why they have to move to where? To the ICU. That is where ICU, they have enough nurses waiting for them. But emergency nurses, they rotate and they move very fast. And they're supposed to be running around. They can't concentrate in treating somebody who is severely ill. They can only do what? Resuscitate. The work at the emergency is not to treat critical care. It's to resuscitate the critical care and move them to the critical care department or to the theater or wherever they can. So the doctors there who are doing critical care management and the nurses there will take care of. After emergency, they have to triage, know your condition, whether to give you the fullest attention in 1 minute or delay your treatment or refer you to another nearby hospital. And they are supposed to create the environment to ensure that the next patient coming, they can receive. It is only when we have mass casualty that will bring so many patients that is overwhelming the hospital that it may not be applicable. But still, they'll still go by the red, orange, yellow, and green. But in this case, red, if you are overwhelmed with disease, with so many emergency cases, red are overlooked at the scene of the emergency.
Okay.
But the yellows, the orange, and the greens are attended to.
In this particular case that has triggered this new conversation, someone knocked him down at Kwame Nkrumah Circle.
Yes.
Before an ambulance picks someone like that, I mean, so for the people who were there, they just simply call an ambulance.
Yes.
Or they put the person in a taxi and rush to the nearest hospital.
Yeah.
What should happen between that movement? If you were an ambulance, what should happen? Where does the ambulance head to? How do they know which hospital is available to take who? For the ordinary person who has just rushed this accident victim in a taxi, they want to just find the nearest hospital. What should they do? How is that coordination done? Who does that coordination? Because there appears there should be a database of someone knowing which hospital is ready at what time. Who knows that thing, and how do I find that?
Omar, every emergency department is ready 24/7.
So
every emergency department.
So at Circle, if they move the person to the Adabaka Polyclinic, they should be ready.
They must be ready. That's what we call accident and emergency department. They are supposed to work 24/7. It is the management and administration that is creating the problem.
Even if it's a small clinic, they should have.
You are saying small clinic. You see, so I think in Accra, even if it's a small clinic, at least and they have a small corner there as emergency department or the emergency unit, they are supposed to assess to see whether he can make it or not.
Talk less of a Rich Hospital, which is a big place.
Now you are speaking. If you go to Rich Hospital, Police Hospital, Legon, Bank Hospital, Kolebu, or any of these hospitals, we have Police Hospital, 37 Military Hospital. Mm-hmm. There is no way they should turn out any emergency patient.
Under no circumstance.
There's no way. There's no way.
Because in this case, this gentleman was moved from to Police Hospital, Ridge Hospital, and then eventually Kolebu Teaching Hospital, where he was pronounced dead. Yeah. This movement should not have happened.
They cannot. They are not supposed. They are supposed to receive the patient and follow the guidelines.
So if I find someone who is knocked down, I should put the person in the car or a taxi. If I don't get an ambulance, I should go to the nearest available place. Health center. And I think generally in Accra, we know hospitals that attend to emergencies. Yeah. It should be general knowledge. Yeah. If you live in a community, you should know which is the emergency or the hospital I can go if I have an emergency. Okay. The ambulance team, they know all the emergency centers. They know all the good emergency places, not units, but departments. Okay. Hospitals that have emergency departments. I'll come back and ask you about attitude because you headed the hospital, and that's the conversation I want us to look at. The attitude of the nurses, the attitude of the doctors. So if everything is okay, what happened? Dr. Bernard Okoboy, you have also been, I'm not sure you've run a hospital before, but you are a doctor, which means you've taken care of issues like, minister, I keep forgetting that one. You were in charge of policy, you were, so it's a policy failure what we are seeing now, isn't it?
Well, first of all, let me say a very good morning to your viewers and to my colleagues and friends who are here. Mm-hmm. I think usually what you hear is that there's no bed, and they say no bed syndrome, but it's just a symptom of many factors. You know, it's a product of many things coming together. Mm-hmm. And I'll start by first of all appreciating the hard work of most of these medical personnel. You know, like they say in journalism, it is bad news that sells. Mm-hmm. Most of these workers are running around the clock 24 hours, saving lives. And when they save 1,000 lives at Ridge Hospital, it is no news. It is that one person that maybe experiences an unfortunate event, that goes to the whole country. So I always start by acknowledging them because I have a feel of what life is in the hospital. I was in Chebi like somewhere 2013. I was working in Chebi, the government hospital. There were occasions where I was the facility manager, you know. So I also have an idea of some of the challenges you face at top level. Let me start by saying that in 2018, I have the report I was going through. There was a no-bed case where a 75-year-old man also went to about 7 hospitals, all said no bed.
Yeah.
And when they did the committee, the work, they found out that some actually had beds. It's interesting. The private hospital they went to, C&J, had bed both at the emergency and in the wards. But some of the public hospitals they went to had no beds at the emergency, but had beds inside, in the wards. Now, so the hospital is like a factory. When you are coming into the hospital, the entry is the emergency. But when you are stabilized or handled, when your life, you are stable now, you have to move inside. Sometimes people stay too long at the entry point, whilst there are beds that can receive them. And so monitoring and some level of effective supervision helps to keep the conveyor moving. So that you always create bed. That's
so that the 24-hour thing
can work.
No, I mean 24 hours in terms of you should not spend more than 24 hours at the emergency.
I don't have a problem.
It's not the NDC 24 hours. Why are you?
It's medical. It's medical.
Thank you very much.
24/7.
Then secondly, the reason why sometimes some patients keep a little bit longer at the emergency and even the medical personnel are hesitant to move them into the wards is that some of the machines you need for a high dependency unit person. High dependency means that the fellow is in a situation where you have to monitor a lot of things. You don't have some of those gadgets in the ward. You know, our wards normally are like lines where they can check your pressure and all that. But to have a machine on you, checking your pulse, your heart rate and everything continuously, sometimes you have it at the emergency and not on the ward. So the doctor is a little bit anxious that when he takes you to the ward, that level of care drops. So they prefer to keep you a little bit until you are stable. And by keeping you a little bit, you are blocking the new entrants. So these are some of the challenges that the doctors face.
But we have ICU, is that not?
So you see, most of the time, the ICU facility is similar to what you experience at the emergency unit. And for some strange reasons, most of the ICUs, you can have an inpatient in the hospital who is at the ICU being handled, a complication from surgery. So you, the outsider, it is even difficult to access. And for some strange reasons, I'll come to the medium to long-term designs. Our hospitals are designed like that. There are so many beds in the wards, but few at the emergency and the ICU. So even in terms of structural design, we must start to look at a few things. You can do that in the districts, but where population density is high, you have to look at the design. So that the bedding, so when you go, the physical space is a challenge when you have to pass through the entry point, the emergency. Look, Accra's population keeps on growing. I was just checking some documents with the WHO. For every population, for every 1,000 people, you should have 5 emergency beds. Lekma, Lejikuku alone, is a population of close to 300,000. If you divide by 5,000, the figure is, I'm sure, is way beyond 30 or 40.
So every 1,000 should have
5 emergency beds per population. That's the standard.
Okay.
If you can't even do 5, do 3. But if you come to Lekma with a population of about 300,000, and they don't only receive cases in Lejikuku, it comes on Crowell and all that. They have just about 10 to 12 beds at the emergency. So if 5, in fact, the main place is actually 5, and they have some 2 wards which can absorb people from the 5. So 4 with about 12 beds. Can you imagine? Teshi, Crowell, Spintex, all it's 4-5 beds.
Even Sakumono.
Sakumono. So within a short time, the place is full. Meanwhile, when you go into the hospital, they have wards. Someone say, why don't you move them? When they move them there, the infrastructure in the ward is not safe like at the emergency. Okay. So that is one problem. Now, when you move them from Lekma, there's no bed, and you try to move them to, let's say, police hospital. Police hospital is also choked. So in terms of physical beds, we need to add some more bed space. Either we expand just the emergency as a quick measure. We can get an architect. We tried to do it when I was in Cape Coast. They still have a plan. When I was at the ministry, we were trying to help Cape Coast just at the emergency to expand. I wanted to do that with Lekma Hospital too, but the Chinese who actually built Lekma had plans to try and expand the hospital. So they said, instead of we going for this short track, we should take our time. So fiscal beds is a problem. The next thing which becomes a problem is equipment. So I'll give you an example. They rush you to, let's say, Mamobi Polyclinic. You have a fracture. You've been hit by a motorbike, or you're on a motor, you're falling. They realize they have multiple fractures. They have a bed. They can give you painkillers, but they realize they don't have an X-ray, or their X-ray machine is not working. If they don't take an X-ray to have an idea of the injury you have, they can't continue managing you. So after more or less splinting your leg, giving you some painkillers, they want you to move to Ridge, where the X-ray machine is working. So you moved only because of equipment, not bed space. And then when you get to Ridge, here you are in the queue. Their places are choked. Yet, if Mamobi had equipment, X-ray equipment, you would have been dealt with at Mamobi.
So it's not just a no bed issue, it's a no infrastructure issue.
Yes. So equipment is one. Sometimes the fellow is rushed there. They have an abdominal problem. The doctor is thinking of acute appendicitis. They can operate, but maybe they don't have a scan or some other machine, or they don't even have blood. Their place is that their blood bank is not that massive. So they'll say, look, you are safer at Ridge, because if I take you in and I need blood, you can be in trouble. So you've moved because in terms of their infrastructure, their blood space is a problem. So people move not because of physical space, but equipment.
But can they reject the person with the abdominal thing at the Mamprobi Polyclinic? Should they? Are they allowed? Because
no, I'll come there in terms of, I'm just touching on some of the things. These are some of the causes, and then the things that we can do. It doesn't mean that we can't do anything. There are a few things that we also can improve. The third one, which is a major one, has to do with the staffing in terms of numbers and the specialization. So you are a cancer patient being seen at Kolebu, and then one night you get a complication and they rush you to, let's say, Lekman Hospital. You are a known cancer patient at Kolebu. They check and realize that you have issue with blood. Your blood has gone down. They will quickly maybe transfuse you 1 or 2. But beyond that, they are handicapped. You need to see the oncologist at Kolebu. They don't have an oncologist. So they would be trying to move you to Kolebu, where you can have a more detailed plan. But in such a case, you shouldn't be turned away. They should at least intervene. So these are some of the 3 or 4, and I think the last major one, I spoke to about 3 or 4 medical health of facilities in Accra. So some of the factors I'm giving you are real life factors. One told me that, doc, health financing is key, and I've thought of that. You know what is happening? They rush an accident victim to Focus. Focus has the best specialists. They can do everything for you. But you know what Focus will say? I'm not saying that's what they say. I'm just giving the amount. Put in some deposits.
So they are private?
Yes, put in some deposits. Maybe the deposit is 50K, 50,000. If nobody can raise that money for you, Focus would like you to go to Ridge, because Ridge is government. Their cost is likely to be down, and should you become a bad debt, some way, somehow, they will find a way to absorb through government.
And it's a business thing. Finance issue.
Yes, and you see, the 70% of the costs of hospitals going into debts or closing down is bad debt from the emergency. Emergency is one of the places where you can build debts and go under if you don't get any bailout. So Focus will say, put a deposit. So you see the ambulance now coming to Ridge. Now, if you go to a bank hospital, they have one of the finest infrastructure. In fact, bank hospitals' infrastructure can compare to any hospital in the US and anywhere. But bank hospital might say that deposit 50K.
Even though they are government? You
see, bank was built by government. But in terms of their financing model and operations, they must raise money to take care of their running, administration, and inputs and consumables and all that. Now, so people go to bank, they'll tell them deposit. Some, guess what? Some find the money for 24 hours. And then when they look at the cost involved, they say, you know what, move me to police hospital. So you have referral, not because they don't have the expertise and infrastructure, but financing.
Okay.
So going forward, I've always, we tried to discuss with insurance. It wasn't going anywhere. We pay motor insurance as soon as possible. Some percentage, if not for motor from somewhere, must go into a particular trust. It can be a wing of the Ghana Medical Trust Fund, Mama case, or health insurance, where any case that is an emergency case can be handled at any private hospital. But for, let's say, a number of days, you don't want to make it unlimited. Otherwise, you can go into. So let's say 5 days. When the 5 days expires, they should write a report of releasing you either to another hospital, to a government hospital. At least we are saying that if your life could have been saved, that 5 days is enough to take you out of trouble. Because if it turns into 1 month, 6 months, then it's becoming a chronic case. This health financing is key. Guess what? University of Ghana Medical Center, one of the best hospitals in Ghana. if you are taken there and you don't make a deposit, they might move you to Ridge. So people are rushing to Ridge because Ridge is so-called government, and Ridge is helpless. Even if there are 1,000, they must be in a queue. Whereas you go to University of Ghana Medical Center with the best trauma surgeons, the place is quiet because of financing. Bank hospital financing, Nyaho financing. So the law should make it that any hospital, whether private or public, should take you, and then you write a report to an agency that will pay for 5 days, and then we can get some.
But over the period, maybe they've tried it and the financing was.
It's not been tried. We've never had a policy where emergencies are taken and you go to a place for your money. Normally, the Ghana Service will issue a directive: don't turn away the patient. But when you keep the patient and you run your consumables and you are into debt, you don't know who is coming to pay. You know, so this is a very critical matter. And like I said, most hospitals suffer. Only one patient can run your finances down.
So your solution is that put Bank Hospital, UGMC, all those hospitals.
They must accept emergencies.
Put them onto the.
Yes, but you must create the financing unit.
So they must accept emergencies without deposits.
Without deposits for a number of days, and then after those days expire, they write a report asking for their money and telling what happened to the patient. Whether they send the patient home, a patient might still need care, emergency care for 5 days.
I'll come back to you, but your colleague is disagreeing.
You see, we can't beg Legon to take patients on a separate policy. The policy guidelines for emergency says if a patient is presented to the emergency triage,
regardless of which hospital.
Regardless whether it's Legon.
But it's a private
No, please. This is a policy by government.
I agree, Doc, I'm coming there with you.
Let's not beg them.
No, I'm not begging. Let me just address that. With all due respect, I even wrote it here. There must be training. Okay? It's one of the things we also have. You know, we have, for every problem, you have the immediate ones, which you can do. Training is one of them. Yeah. You have the medium term, in terms of adding physical bed space, building and all that. And then you have the long term in terms of policy and all that. I know of the guidelines that says that in Triage, and that one, it is not subject to compromise. So I agree with you. Now, a patient comes, you've triaged, I've checked you, and I've realized that you actually need blood transfusion. I have to intervene, but I don't have the blood. After triaging you, I know what to do for you. If I don't have blood in stock, and I take you to theater, and I operate, and you die from hypovolemic shock for low blood, nobody will forgive me for saying that if I moved you away, maybe you suffer more struggles.
Go for the blood.
You understand?
So it's better I transfer you.
Yeah, so it's better I communicate with another facility, either to bring the blood.
Bring the blood.
I'm coming. Either to bring the blood, or you go for the blood. Sometimes I'm taking you to theater, but I don't have an anesthetic. I have only one anesthetic lady who is pregnant, is not available. I can't operate you without the anesthetic. Okay, so the point I'm making is that the training is important to ensure that you intervene, and the physical intervention is key. With Ridge's case, because of medical legal matter, I'm not going. But sometimes they intervened without a physical intervention, and I explain. Medical staff went in, checked on the patient, looked at oxygen concentration, realized that this patient needs oxygen once you bring out, only to have a situation where all their oxygen outlets were being received by another citizen. You can't say that, let me take the oxygen from Umaru and give it to Jock for some time. So their suggestion was that we've communicated with another facility. They have an outflow. So move the patient. But the mistake is that if those watching, both relatives, all that you've done, they have no idea what you've done. But if you had even going in with setting another line, like you've a physical intervention, like I call it, do something, put in a few things and write, then you know that, oh, Ridge didn't just send us away. They did an intervention. So the training is important. And
question, the ambulance truck with everything in there, is that not a moving hospital?
Yeah.
No. So can the doctors, if they don't have the bed, can they not enter the ambulance?
That's what I said, it's already happening. Our doctors and medical staff are doing their best. Sometimes they give a treatment plan for the patient in the ambulance for about an hour or two. When now they move someone to the ward, then they bring the patient to the space. All this is happening. They are doing their best to make sure that they save lives.
In this particular case, it did not happen.
That's what I'm saying, that in this case, they did the assessment in the ambulance and realized that the oxygen saturation for the patient was low. This patient you don't just bring the patient to the bed, but must receive oxygen. With the others having oxygen, an ambulance was actually having an oxygen concentration. I think they think the flow was not sufficient. Theirs would be better, but others were on. And after 15 minutes of assessment and negotiation, they were like, look, after all this, they would better be placed if they continue receiving and this is not to give an excuse. I'm just giving you what is happening. If they continue with the ambulance oxygen and get a better flow oxygen at the next facility. But what would have made things better is that the relatives and family would have been happier if there's fiscal intervention. Two ways. Either you go in there, set a line, give an IV fluid, give some chest, how do you call it, a dilator, something that would end the situation before writing a report that we are moving on the care to another place. So the optics is important. That's why training is good, because a young doctor who is looking at only the management plan will tell you that these are the 3 steps I have to take. I've done that. Meanwhile, myself with my experience knows that without a fiscal intervention, you are in trouble with patients. And I'll end with one example at Chebi, where a patient came very bad and virtually brought in almost dead. And I asked one of the nurses that, go and set a line. He said, Doc, this patient will not benefit from a line. I said, you set a line and put a fluid. You see what will happen. This patient died. Within 3-4 days, the whole family came to the ward to come and give them foodstuffs and to thank them. Why? Wow. Because they made an effort to save their patient. And that they knew, they said they knew the patient was in a very bad state. But if they had not done that,
if you had rejected the patient,
yes, we were in trouble. So it is training to manage both the medical plan and the public perception plan.
Okay.
So our doctors are doing their best, but we can improve. Okay. Monitoring, supervision. We should also have a committee. Every case of death from pregnancy-related issues, we hold meetings in the hospital on them. When any woman who is pregnant dies, there is a whole meeting involving management in every hospital in Ghana. Really? It's a policy. Yes, they call it maternal audit to find out what went wrong. It can be a problem with the one who should have operated, a problem with the receiving nurse. We doctors do it. Doc was doing it when he was in service. We should bring that attitude towards emergencies. Any death that happens in emergencies, even when it doesn't come to the national level or even in the hospital, if you lose a patient for an emergency, there must be an audit to show whether we could have done something. For now, the practice has been that if you die, it is your time. But that cannot be the case. So, and
it's not just because they want to tick a box. They actually do this meeting in the audit.
Yes, for maternal cases, we do it to identify where the woman, what made the woman die, and for some strange reason, even if it looks natural, we always try to put it somewhere so that we can improve that place.
If it happens in maternity, it doesn't happen anywhere else. Does it happen in surgical?
The level of attention that one gets is not the same level that others get.
Is it because someone is paying for that to be happening, or someone says that should happen?
I think it's because over the years, studies have shown that with improvement in every corner, we can reduce the number of women that die through pregnancy-related issues. Okay. And we've convinced ourselves that no matter what happens, it is human-related. Well. So we can improve. Okay. And I think we can do that with emergencies.
Okay. Andrew, I'll come to you to look at the legal side of things for me, but I want to come to Doc. Doc, yes. You are not a medical doctor, but I'm sure you may have gone to the hospital or sent relatives. You've had 2 doctors. They are both working in the policy space and also political space, but of course they are professionals too. Based on what you've heard on the situation with the gentleman who was knocked down and the explanation they have given us, where, as an ordinary person going to the hospital, where do you put the fault? Who do you blame? And how safe do you feel going to the hospital?
Actually, my PhD is in public health. And I've taught at the College of Surgeons and Physicians, and a lot of public health schools in Ghana. Biomedical ethics. I think in that kind of situation, Dr. Okoboy has covered a lot of the issues: organizational, infrastructural, administrative, and human resource, everything. He's really covered, and Dr. Anaba also brought in his piece, experience, and policy issues. So there is actually very little to talk about by us. However, I believe that there are a lot of issues that have not also been touched upon. Many of the hospitals want to reduce the death rate statistics they maintain. So some of the referral they make, it's not because they don't have bed in the emergency ward. It's not because the triage is not being done. I was once an auditing person for an emergency response, assessing the readiness of our hospitals. I don't want to mention the name of the big hospital where I was one of the auditors. I was quite disappointed with the doctors' responses and the nurses' responses, to the point where there was a surge for a moment just to create a situation to assess how they will react. It was very bad. The triaging was below, it was suboptimal. So in a case of emergency vehicle taking an injured person, Professor Zakaria, I'm sure when he was running, he was running the emergency program, and during his government's stay, everything was going quite well. But I don't know what is happening now. Whether there was proper coordination between the crew on the emergency and the hospital where they took the person. If there is no coordination, as our two eminent doctors have told us, then of course the triage will not work, because if you don't coordinate properly, the emergency ward will not be ready. And sometimes they treat the emergency ward as if it's the OPD. And then sometimes it's really, really not a good thing. So the infrastructure is also part of it, and the human resource and the specialists that will attend to it. I don't know what kind of message the team in the vehicle relayed to the hospital where they were taking the person.
You mentioned Professor Zakaria, he was head of ambulance service.
Yes.
What do you know in the past was the communication channel between the ambulance service and the hospitals? And are you suggesting that may not still be working the way it used to work?
Well, we shouldn't blame everything on the doctors. If the team, the EMS team, is not properly educated to even assess the situation, to give the report to the doctors that will attend to it, definitely there's a broken communication line right there. You know, so sometimes it's the fault of the EMS team. How do we train them? I know how they were recruited, many of them by Dr. Baumia's team when they were being called to service. I know that.
I don't know what you mean.
Oh, well, let us not get there.
No. I mean,
let us not get there.
No, we'll not get there. But because you mentioned the name, I wanted to be sure. I mean, if this is an allegation that
when they were being called, about 600 of them or 300 of them at one time at the Flagstaff House or Jubilee House at that time, that were being honored for being recruited into the EMS team and all of that. I know I have people that were actually there, and I was talking with them while they were there.
This way, Dr. Okubo, you know about this as a matter of fact? Because it sounds like an allegation.
I think we're having a nice discussion. Maybe you don't digress a little, so bring them back.
Yeah, that's what I'm asking, because I don't know about that.
But the point I was trying to make is that how were they selected?
Are you saying they are not professional?
Initially, no. They had to go for training.
So they were brought in for political reasons?
No. I mean, they had to recruit the youth. They had to give job to the youth. So that was one way.
A particular kind of youth?
Well,
I mean, speaking for the service, yes. Even no matter where you are brought from, before they pass you out, you receive the training.
They receive training.
Okay. But so I'm saying this because I'm thinking it's not fair that you mentioned that they were brought through Dr. Baumia, because if they go through professional training, I mean,
the selection was not professionally done.
Politicians always have these things where they have.
There's a
list they call it.
That is where the
selection.
So we're saying that the recruitment abolition was wrong.
Meritocracy. The selection was done.
I would have said that without mentioning it.
Yes, that's what I think.
Umaru, you are the best journalist for today.
But I was a witness. I was a real witness to what was happening, because I had people that had been selected.
When you make a statement on a show like this,
yes,
and I don't have evidence to support your claim, and it is you who know this and I don't, and I can't prove it.
I know.
I would not like for you to say something like this unless there's evidence to show. And to the extent that
if I knew that this was going to be an evidence-based kind of thing you wanted, I would have brought the evidence. Or you can follow up.
No. So I would appreciate that you have
you can discredit or credit.
No, but you avoid names.
Okay.
So that I don't land in trouble with you. Thank you.
Okay.
Yes.
I'm available to be arrested if you want to.
So continue.
All right. So the selection process, the initial selection process of the EMS crew, was not based upon meritocracy. They did not even.
And is this something happening all the time in the past, or is this a one-off thing?
I'm talking about the initial selection process.
I'm saying that.
And they are now the leaders because they were the first crew. So they are now probably the supervisors and so on and so forth.
Which first crew? Of the ambulance service?
The ambulance service. I'm talking
but
about the
ambulance
people.
for many years. I don't understand. I'm looking at timelines.
Oh,
so what do you
no.
mean?
If you can bring Professor Zakaria and he will give you a bit more details.
Are you referring to the new ambulances that were brought in the Akufo-Addo ones?
Yes, you needed to fill them with people.
So from that period,
Exactly.
that's what you are talking about.
Exactly.
So I want to be sure so that timelines work well. Because when you say the first time, I think ambulance has been in Ghana for decades. So that's what
in an organized way. That was the only time we have had a large number of ambulances, and where large numbers of people were recruited.
Very well. I understand you now.
Okay.
Good.
Okay.
So proceed.
So the selection wasn't very good, and so when you start on a very poor level, some of the people that were recruited probably should never have been there. Okay. So if they are communicating with a hospital, in order for them to prepare the ground, and even before you get the patient physically in front of you, you have to have an idea of how you are going to do your triaging, especially if you've been told of the kind of injury. So for me, I think that the issues that we're talking about, I've done a few papers on assessing hospitals' readiness in emergency responses, and it's very, very poor. In 2012, Ghana Medical Journal, it was published, and I continue to do these kinds of things. And so I believe that Dr. Anaba, what he's saying is that yes, the policy is there, but our doctors are not following the policies. And the new doctors need a lot of training. As Dr. Okoboy was also mentioning, part of the reasons why the hospitals don't want to receive people unless you put money down for whatever the emergency, going back to the policy, is that the National Health Insurance Scheme is a little, and you were there, Dr. Okoboy, it's not inclusive in terms of the coverage of the emergencies and diseases that are supposed to be covered. Every time I see on TV people soliciting money for leukemia or whatever operation overseas, it breaks my heart. These are things that are supposed to be covered by the National Health Insurance Scheme. UK has a National Health Insurance program. They never let their people go out and solicit for money from private people in order for them to take care of leukemia or whatever the disease may be. And so I think that because of corruption within the medical system in Ghana, that is an issue I'm sure our good doctors don't want to bring out. But in 2012, the WHO did a study on for every dollar spent on healthcare in Ghana, only about 10 to 12 cents is actually spent on health. The rest goes to administration and the rest are stolen. So we did an assessment of the hospital readiness of emergency care, the supplies there. And in one hospital, in the emergency ward, I actually went through to see the medicines that they have packed in the cabinet, whether they were actually the vials of the medicine, Procodam and all of that, those painkillers, they were all there. They were empty. They were just the packages that were there.
So someone diverted it?
Somebody stole it. Okay. Use the word. Somebody stole it.
So thievery in the health sector
is big. So it undermines a lot of the equipment, because Dr. Okoboy mentioned that some of the equipment you find, how many of our doctors actually have access to working X-ray machines? And how many of our new doctors actually can interpret X-ray report or ECG report? Many of them don't have the capacity, the new ones. So we have a systemic problem with our healthcare system.
So for you, the professional training...
I differ with my senior brother.
You don't agree
the doctors don't know how to interpret X-ray.
Some of them. Some of them.
It is a structural problem. There's a full strategic failure in the health sector and lackadaisical behavior of we politicians, governments upon governments, to attend to the health sector. Why are they crying for money that we should get and borrow money and give to cocoa farmers? When we are not crying for us to borrow money and give to the health sector to provide the needed infrastructure, the required numbers for us to attend to ourselves. He was just telling us every population of 1,000 needs 5 ICU beds. Do we have it?
No.
Who is fighting for it?
Nobody.
You want to increase the health budget to even meet the ECOWAS convention? You won't get. That is where the problem is. Okay. I'm not saying that what I read today blaming doctors is because the doctors are the cause. It's because there's an administrative failure.
Yes.
And that includes financing.
Okay.
If Rich Hospital has monitors at emergency to take care of patients, but don't have monitors in the ICU and the ward to take care of patients who are supposed to be transferred within 24 hours, then management has failed.
Yeah. So Dr. Norman,
that's the problem.
So Dr. Norman, you may have a challenge with professional training and all of that, but I'm not sure a doctor would have a challenge as basic as not being able to read an X-ray when they put it in that glass thing with the light.
They will not.
Maybe they will not have the glass thing that you used to read.
Some of the new doctors, my gentlemen,
now
will not admit it.
We have radiologists, simple X-rays they can read, but there are complex X-rays that you need a specialist to read. There are two different types of X-rays.
Thank you. With all due respect to Prof. When you
I'm
draw,
not a professor. I'm a doctor.
When you draw the curve in every profession, you can have a chartered accountant who is getting the basics wrong with accounting. But in terms of the majority, the curve, majority know how to handle basic X-rays. Okay. So, I mean, you can find a doctor like that, but it will be
it's rare. Yes. Okay. So conclude for me.
All right. So for me, I think there has to be
retraining. There has to be retooling versus retraining. Which one should prioritize?
Both of them should go hand in hand. There should be synergy between the retooling and retraining. Because if you bring new equipment, you have to train the people how to use it, right? So for me, I think that this government is trying its very best. Without this government's effort in the first term of Mohammed's presidency, COVID would have taken care of a number of people. They would have been dead.
Because he will not agree, even though his former boss
he would not agree, because it was because of my advocacy that he was brought to Minister of Health.
Oh, really?
Yes.
So has he paid you?
There was no. He's never even thanked me.
Oh boy!
I will say it in front of him, in front of everyone. He has never thanked me because he had an accountant as a minister. Ajimamenu.
Yes.
Then we had a beautician as a deputy. Then we had a lawyer as a deputy. It was on one of the programs that I said that the government is out to lunge, and I whistle like that, and because it was horrible. Luckily, Kwame Mpianim agreed with me that you cannot have a ministry where you don't you don't have any doctor in there. Okay. That was why he was brought there.
So you're saying that currently too we should have a doctor as a the deputies.
The deputy we have. So now the setup is fine.
It's fine.
And Honorable Akando is doing a fantastic job.
Okay. Thank you. Council, the legal aspect of this thing. So a lot of the time we do famanyami. Lawyers don't do famanyami. That's why you are there. What guidance and advice would you give to people who, because now we've been told that there's a government policy that says no one should be rejected, and yet people keep getting rejected. I want to raise a conversation around the legal side of things. What can people do? What should people do? And how do we protect lives using the law?
Yeah, so good morning to your lovely viewers. I see you want to limit me, but I won't be limited. let me say good morning to my honorable. It was lovely listening to Okubo and Dr. here. And after having listened to them, Umaru, I'm convinced that the fundamental reason why we are facing all these problems is because of the very Machiavellian politics we do here. The politics we do in this country focus isn't the human being. The politics we do in this country is all about how we get power and how we sustain ourselves in power. Because if you do politics in the right way, in the manner Aristotle advised, that politics is a science, is a master science that uses all sciences. So medicine uses economics, uses law. To what end? To create virtuous men. So in Aristotle's ideal mind, in the end of politics, the human being must flourish. So the human being must be at the center of our politics. You understand? When I listen to Doki and I listen to Okuboy, and in fact, you should give Okuboy more time. I love the angle he was going. He was talking about policies which would have solved all these problems. And I wonder why again. And thanks to you. And I'm not saying because he's here. I'm not in his party anymore. But he was one of the people I really he has some technical expertise that I think we need. It's a merit. Why it took Nanado, I was going to say Nebu, I say you are very well done. I was saying Nebu. Why it took Nanado so long to appoint somebody like him as because you see, we took upon ourselves a constitution whose purpose was one, to guarantee us our rights to life, our right to our liberties, and our right to pursue our own happiness. Indeed, Article 13 of Ghana's constitution guarantees every citizen the right to life. That provision is not decorative. That provision is not symbolic. It is a binding national commitment that governance in this country must place human life above convenience, above bureaucracy, or above political comfort. But today, serious questions are being asked. When citizens reportedly lose their life because hospital beds are unavailable, because emergency response lacks urgency, or because institutions move too slowly in movements that demand speed, then this is no longer simply a healthcare management issue. It becomes a constitutional issue. So to answer your question, we all have a fundamental right to our lives, and this is a right that is justiciable under Article 33. And people who have lost their lives because people have undermined him have a right to pursue redress from the courts. But having said that, and having listened to my esteemed colleagues here, I believe that if there's a time for us to radically confront the politics we do here, if there's a time for us to radically change the purpose for why we do our politics, then the time is now. Because you see, because human beings are not the center of our politics, what the healthcare the challenges we are facing in the healthcare can also be seen in all other sectors of our country. You go to our educational sector, and there are real problems there. You see the roads. Sometimes you wonder, so these bad roads that have been, and sometimes you can see very newly constructed roads, and you wonder, have these roads? How did our civil engineers certify for these roads to be used?
It's corruption.
And again, so because, and why would people be corrupt? Because most of the money that those who are corrupt purposely steal, they don't use for themselves. When I say for themselves, for their personal comfort, but they use it to perpetuate themselves in power. You understand? So our politics has become so Machiavellian that our politicians have lost focus. I mean, there's no commitment to why they ought to do politics in the first place. And the sad bit is that we, the repository of sovereign power, because we say we claim we run a democracy, so means that the power resides with us. How the very Machiavellian nature of our politics has been normalized. And so something can be A, you can see something that is A, and then the politicians will say is B. They'll spend money to buy some journalists. Frank here, the journalists will use PR to try and sugarcoat, and then the problem is still there. Or
they'll raise propaganda secretaries and communications directors who will sell that to maybe not journalists.
Exactly, and so we are almost 69 years old as a people, as a country. We are 69 years, Ghana, and sadly, in my opinion, in my humble opinion, we are retrogressing as a country. This country is unable to create the environment where we will have virtuous men. Because you will talk about the medical doctors. Not in the 80s and the 90s, even in the 70s, a lot of Ghanaian doctors left this country. Not because of lack of competence, not because they don't love human life, but because our politics is very negative. They simply did not have the infrastructure. You understand? That will also give them self-actualization. You understand? Okoboy gave a study which meant that in Ghana, for us to meet the WHO requirements, we need 170,000 emergency beds. It means that in how government uses its fiscal policy, increasing the capacity of emergency in our hospitals ought to be a priority. He went further to talk about the financial modeling that would prevent instances where people depositing would then, and that's what I was enjoying. Why is it that no law, we have parliamentarians, and I've never heard a call ever, or if there is, probably I don't know. I stand to be for a comprehensive health policy that would deal with all the issues my esteemed colleague here was talking about. Because why should any Ghanaian lose their life only because what's it called? They can't find 50,000 Ghana to deposit. Then it also means that our inability to create an economy that creates, I wouldn't even say wealth. When I say wealth, I'm going too far. But that enables us to have the necessities. It's also a matter of life and death. Because we've created an environment where we are increasingly very poor. You have this cocoa issue. Before real government intervention came into the system, the cocoa farmers were rich men. They were wealthy men. Now, because of our politics, they are the poor men. So that even in how we've managed the economy, we've managed an economy that creates poor people, but it's because of the kind of politics we do in this country. The politics we do does not benefit us, the people. So the politics we do is just about how do I get power. How do I sustain myself in power? And we've done it in so long a time that it's become a culture here. So we need leadership. So when we are talking about leadership now, we need a leader, or we need leadership who won't be judged just because I've built one bed here, I've built one hospital here. But we need a leader that will create a system, a comprehensive system that benefits us, the people. And so that means that we have a comprehensive health system, not just hospital, because sometimes we throw money at issues, but we will have a leader who creates a comprehensive health system. We will have a leader who will create an educational structure that brings up virtuous men.
So for you, it's a leadership thing, it's a politics thing.
It's a radical political issue. You see, because
I hope you are not driving this towards UP, because you see whether UP or not. You see, my senior brother here. Because you see, we've had leaders for 69 years, and we keep having leaders.
You see, I don't believe that. You see, I don't believe that we do not have people in Ghana who are not capable of bringing about the transformation.
So it's a heart.
We need. No, but you see, it's a bigger problem now. You see,
or you say Abba.
Oh, there's a massive improvement.
Okay.
There's a massive improvement
from in the health sector.
Generally, there's a massive
in the health sector.
No, but you see, without a fund for accident victims. You see, without
why do you fund for accident victims?
You see, even in the New Patriotic Party. Even the New Patriotic Party I left, I'm on record to have called the party familiar.
Even that could have acknowledged that the system is good.
I believe there are people in the NPP today who are capable of granting us that kind of leadership. But I'm saying, when we reduce the matter to partisanship, then we lose the point. All I'm saying is that we want a leadership that also recognizes that fundamentally you need to use your leadership to create a culture that will enable virtuous men. You understand? That will enable people who appreciate that. Listen, the most important bit of everything we do is the human being.
Okay.
You understand? Our leadership has been reduced to or have produced, and then we go and clap. You understand? Without thinking about a comprehensive strategy that will alter the entire system and that will create a new culture. A culture that will create virtuous men.
Thank you so much. He's refused to take I gave you an invitation to treat. I wanted you to do the legal side of things.
I did the legal side.
Okay, you went to the constitution. You're interested more in the leadership.
What I'm talking about. It's not legal.
I get you.
What is law?
I get you.
Once again said, law is risen.
I wanted you to say that you represent the family and go and sue the Ridge Hospital.
I'm not supposed to do that.
Omar, there's a fund that people are grieving that we should create a fund for accident emergency. Which sometimes I ask myself, all the funds we have created, are they working 100%? National Health Insurance was cut by the previous government. It could even be used. It could be some of the courses that has not made hospitals to get money to buy equipment.
So we shouldn't create an emergency fund.
Let's use the funds we have now to the optimum.
Okay.
It's when we now see that we have used it and it's not sufficient, then we create another one. We go and create this accident fund, and I'm telling you, tomorrow we'll cap it again.
It's your problem as
Parliament. Now that we have uncapped, you see, we've gotten money for chronic diseases.
Parliament, you should do that work.
No, but we are following what the government is doing.
Let me go. I want to hear from Dr. Kwame Asiedu. He's a public health person with CDD. Doc, you're welcome.
Thank you.
You followed the conversation in the studio Our public health system, a lot of things wrong. That's generally what I'm getting from around the table. Is that a conversation you would agree with, a theme you agree with?
Thanks. You see, yes, there's a lot wrong. And I like the fact that lawyer is saying that it is a political rather than a health problem, so to speak. And I'll explain. You see, health relies on two things at the end of the day. You diagnose, and based on the diagnosis, you act. And based on the diagnosis and your actions, you get a prognosis, and that prognosis leads to an outcome. That is simply how health operates. And that's what Dr. Koboy was trying to explain, and Dr. Anaba was also trying to explain. So you basically try to intervene and triage based on getting on what the hell is going on here. And then on that basis, your interventions and other things would lead to the outcome, whether the person would be saved or not. But the point is that when you are intervening at the diagnosis point, you need tools, whether you like it or not. And that is why I say it's a system and a people's problem. Because Ghana knows the state of our emergency system. There are two documents that were released that did a diagnosis of our health system. Dr. Norma was talking about it. He didn't want to name the document, so I'll name it. There's one called the Holistic Assessment of Health Program of Works, released in 2024, May 2024. And there's a Health Harmonization Assessment Report, also released in 2023. It diagnosed our health system. And in the diagnosis, it told us clearly that should someone get into an emergency border, the likelihood of them passing away was higher than them being saved. So I'll give you a few data from the Health Harmonization Assessment. Only 27% of health facilities surveyed in the country had ultrasound. Less than 5% of facilities had fluoroscopy, CT scan, and mammogram. Only 40% had, 60% lacked MRI services. Ultrasound was available in 80% of regional hospitals and 94% of district hospitals. So it tells you how the bias looks. Then it goes on. Overall, 11% of facilities had a written emergency safety plan. Facilities with emergency response was only 7%. That's not me saying it. And when these were released, my brother, Dr. Koboy, was Minister of Health. So he knows of the documents I'm talking about. Because I've written at length about these two documents, both for CDD and on social media. So everyone knows these documents exist. If you go to the Health Harmonization, Holistic Assessment of Health Program of Works, it catalogs a number of failures we have had in emergency. But you see, the problem is this. We do not shout when these reports come out for us to do retooling. Because when you have documents like that, which are official, which are produced by the government of Ghana, collaboration with the WHO, and sometimes Global Fund and donor partners, we need to get our politicians to act to fill this. Because both documents were clear that the hospitals needed retooling. Because retooling had not been done in our health system since 2014. So when something like this happens, and Dr. Okoboy was very candid, and I must acknowledge that from him, he explained the lack of equipment, that sometimes you have equipment in the emergency, you don't have it in the ward. I mean, if you look at blood service facilities, less than 30% of our hospitals were adequately trained. And that is in the Health Harmonization Assessment. I'll send a copy of the PDF to you, Umaru, so you guys can go through it and you'll be shocked. Only 5% of our consultation rooms had the full consultation and amperometric equipment to make a diagnosis. 95% did not.
Doc.
So why?
So let me ask you. So again, forgive me, but what you are saying is the ideal situation. We are not. It's
not the ideal situation.
No, I'm saying that
is the situation of our health.
No, so I'm saying that what
at when the report.
No, so I'm saying that what you have found is contrary to what the ideal situation should be. But as a country, do we have the capacity? Can we do with what we have? So the fact that we don't have mammograms at all hospitals at a certain expectation, can we say that because there's a mammogram at a private facility that you can go and use, that should suffice? Can we say that we must not necessarily all have MRIs in all hospitals? Can we say that we can live without that? Is this something that we can work with?
I was going there. That is why I'm saying it's a people and systems issue.
Okay.
Like I said, if you have to intervene, you require the tools. Dr. Anaba was very candid as well when he said the guidance from 2011 says that anyone who comes to the emergency has to be seen. You cannot turn a patient away. But Dr. Okoboi then made an intervention to say the patient was seen. However, an assessment was made that all the oxygen equipment in the hospital were underused. Why was that? Because only 35% of our facilities, again, the holistic assessment, have the full complement of oxygen supply. So, Umaru, if I were to answer your question, if we say make do with what we have, then we will get the outcomes we are getting now. That was why I was saying that diagnosis, prognosis, outcomes. And that is why when the outcomes come and we start shouting, Dr. Norma was very, very candid. We know what our problem is. But we wait for the poor outcome to come and then we say we do not have what we need. But you know what? We have signed up to provide universal health coverage by 2030, which says finance should not be a barrier to health access at the point of use. But here is Dr. Okoboi telling us that our health financing model makes it such that even though the emergency in UGMC or bank hospital or a private hospital is quiet and they have the the required equipment and know-how and human resource to treat, they require a deposit. Yet we said we are going to deliver universal health coverage by 2030, which is in 4 years. You see, and for me, that is why dealing with this, we need to do a number of things. There needs to be an honest and candid investigation of this, not by way of finger pointing, blaming health professionals or blaming the system, but to identify as a country whether we have been candid with the diagnosis of the problems in our health system to start with from a political economy standpoint. Because if we do not get that right, look, Umaru, you've seen a lot of my writings. I hear even some of them were read on City a couple of days ago about no-bed syndrome and emergencies from 2021, 2022, 2023. It gets tiring. The fundamentals are always the same. The fundamentals are that we know the problem, we know the solution, we do not make the political economic investment in the solutions, and wait for the poor outcomes to happen, and we all start shouting and sometimes make politics of the situation. That needs to stop.
Okay.
I must say something. If you look at the current budget, I am glad that funds have been made available for retooling. And I hope that retooling would happen.
Okay.
I've heard the minister talk a lot about retooling, PPPs, and other things. Those are positive noises. But after the first year, now we need to see the real action so that 12 months from now, we wouldn't be having a similar conversation. You know what? We're having this conversation because it happened in Ridge Police Colony. I must tell you that in the hinterland, probably every other day it's happening. But because we do not have the coverage that these hospitals have, we are not hearing of them. And that is why I've been expansive to bring in the known diagnosis of the problem with our health system based on our own government commissioned reports to say that this is only the tip of the iceberg, and I'm not going to confine myself to the tip of the iceberg because the problem is bigger than that.
Thank you. Thank you so much. Let me bring in Franklin Kojo also via Zoom. He's president of Imani Africa. Franklin, finance is a matter that we are looking at here, and the thinking, and Dr. Anaba has just said it, if we want to really throw a lot of money at that, people will complain. Can we really, do we have the capacity, first of all, in our economy, to retool the health sector? Because everything we're talking about here is finance. And I'll get to attitude later, but finance, how much can we pump into our health sector? Do we have the capacity to do that?
Good morning. Can you hear me?
Yes, I can hear you, Franklin.
Great. Good morning to my seniors in the studio and to my brother on virtually as well, Kwame. We do have the money, don't we? I mean, if a country chooses that, even though God ought to be praised, that God has not actually endorsed a cathedral, and you spend loads of money on a fictitious dream, and you keep pumping money, but if these guys had been in power by now, would have attracted almost $1 billion into that thing called a cathedral. And that money could have been used for something like this. So I think, again, the priorities, and I think my gentleman, sorry, my doctor, UP guy,
Andrew,
and I think
his name is Andrew.
Oh, my brother, you spoke well, and you see exactly the issue. We politicize everything to the extent that even the choices we have to make for our own salvation, we politicize it, and I find it so difficult to understand the choices we make sometimes. I mean, and even under this administration, I'm sure there are certain choices that are being poorly made. And you see that as well. So I think it is important that beyond having something like a savior, like John II, who comes and says, "Mama cares." Well, every politician should care anyway. You don't even have to put your name there before we show that you care. I mean, at the end of the day, it is exactly what we want. Every citizen must be recognized by the system. I think for some of us, some citizens just leave home. Some just leave. As Kwame is saying, if you go to the hinterland, some of these things just occur on a daily basis. So it makes us believe that, well, you're in a city and within 2 hours, drive radius, you can't find a bed. Even if it is the case that, well, some people want to reduce mortality rate. I mean, how do you even assume people lack that empathy that they can't even say that, look, we want to take young people. So apart from the politicization, again, I think the other thing Andrew talks about is that, yes, we, the human being themselves, have been wired in such a way that we become so commercialized to the extent that we want certain outcomes and we don't want to touch what is probably undesirable. Then why are you in healthcare? So it goes everywhere. So the question you asked about finance, I do not believe finance is our problem at all. I mean, if you look at the choices we make in this country, I mean, what did John come to do? Within the shakes of a lamb still, he reduced the size of government from 120 something to almost 60. These are decisions that can be made instantly. Then you save money and you make the choices that you have to make. To the credit of the NPP, though, I have to say that the idea of putting hospitals everywhere maybe made a lot of sense. But the idea of just throwing hospitals there because it was a procurement gig and all of that didn't make sense, because at the end of the day, these hospitals have to be staffed, have to have all this equipment, and all of that. But
the ambulance intervention, though, is a big one that we're celebrating. We could have
exactly more. The point. No, we should, and we should be having a lot more of them and equipped properly. So it was also a good intervention. Okay. I've got to say that we need to maximize these things the more. And please, finance has never been a problem. I don't believe that at all. Okay. So please drop that one. Thank you.
Thank you, Franklin. Ghana's main problem is that the doctors have taken over all management positions in the hospitals. When I was in England, there was a scientific formula for the calculation of beds. For example, occupied beds, available beds, length of stay, death or discharge, bed, etc. That's from Kweku in La Paz. This one says, this no bed syndrome must stop. No amounts of beds can replace human life. Most often, the attitude of our health professionals leave much to be desired. That's Jones Aduboy in La. This one says, I think the minister has to subject the personnel in this hospital to sanctions to deter others from practicing the act. That's from Safiano in Pusiga in the Upper East region. I do not think there's anything like no bed syndrome. I strongly believe it is a clear case of weakness and planned exploitation from prospective patients. That is a message. I don't think this one has a name. My name is Iris from Tesano. The design of our hospitals is not conducive Everything is spread out anyhow. Relatives are handling things they shouldn't handle. Go to pharmacy, go to lab, go and get bed mat. Bottom line, the chaos is too much. That's true. He says in UK there are no visiting hours, but there's that quiet security in place, CCTV cameras, and you are aware you are being watched. Hello, Maru. I'm Kwame K, a private health service provider. In fact, as a country, we always pretend to be doing one right thing or the other just to be winning public favor. Health facilities are really struggling to do basic maintenance of our equipment. This other message says, what can 55 Ghana cities do today in this country? But in Ghana healthcare, that is the highest amount to provide OPD service, including all laboratory investigations. How can a facility provide the service out of that figure and still reserves more of maintenance in case of any eventuality? This message says, as stated, the 55... Okay, so continuing. Our health minister came to announce that they have increased the tariff between 100 and 1,000%. It should give a single evidence that they have released new and better tariff for health facilities. Let's stop deceiving ourselves. More messages coming through. You can also send your messages. The WhatsApp number to send your messages to is 020-444-7033. This is a big issue on 97.3 CTFM and on Channel 1 TV. When I return, we'll look at the attitude and then this committee that has been set up. What should we gain from this sad situation that we are talking about? Please stay.
Go Ghana! This March, we don't just remember where we're from, we celebrate who we are. Our stories, our culture, our rhythm, our pride. And it all begins with an evening designed to set the tone for an unforgettable Heritage Month. Join us as we officially launch the Heritage Month 2026 in grand style, color, and culture. Date is Wednesday, 25th February 2026. The venue is the Channel 1 TV Gardens. The time is 5:30 p.m. prompt. It will be an evening of culture, conversation, music, fashion, and storytelling as we unveil the exciting lineup of events and programs specially curated for you this March. From powerful cultural experiences to engaging community moments to celebrations that connect generations. The Heritage Month 2026 promises something for everyone. This is more than a lunch. It's a gathering of cultural lovers, a meeting of tradition and modern expression, a night that sets the heartbeat for the month ahead. The Heritage Month Launch 2026. We will see you there. This event is strictly by invitation.
Triage Secondary School invites all alumni and stakeholders to the 67th anniversary and homecoming celebrations. It's happening from Friday the 20th of March to Sunday the 22nd of March 2026. On Friday, How I Got There, 9 a.m. to 12 noon. Year groups check-in and roll call. Gary Soaking's competition, cadet course ceremony from 2 p.m. to 4 p.m. All students convoy. Drive to Swesco, 4 p.m. to 6 p.m. Candlelight procession from 6 p.m. to 7 p.m. Welcome cocktail with alumni and staff of the school. Meet and greet with Compa Band performing live at the forecourt of the school complex from 7 p.m. to 10 p.m. Saturday, speech and prize giving day from 8 a.m. to 1:30 p.m. All year groups lunch from 2 p.m. to 4 p.m. Alumni dance party from 6 p.m. to 10 p.m. On Sunday, anniversary Thanksgiving service at 8 a.m. A great opportunity to reconnect with your old mates. Contact your year group president now. Semper Cum Optimus, always with the best.
The admission letter actually stated that we had to pay our fees within 8 days. And when I finished in high school, that was in 2016, I had to stay home for 6 years.
COPE, the City Opportunity Project on Education, was born from a simple belief: no student should watch their dreams die because of poverty.
My parents said that there is no money. I should have gone to Lagos. Why would I choose UPSA? UPSA is so expensive.
I would just say don't give up, right? I didn't know help was coming, but help came.
You have to wait for your elder sibling to finish school before you can start. So I had to wait for my 2 elder siblings to finish school, and then now
before you could even start.
Yeah.
It was so bad that without school, I wouldn't have been to school. Like I would have been in the house.
The story of COPE is the story of hope. A Channel 1 TV documentary.
Yeah, welcome back. This is a big issue on Channel 1 Television and on 97.3 City FM. I'm Umaru Sanda Amadu. Let me now go around the table. We've had a discussion around the no-bed syndrome. I want to connect it to the health sector generally. So, gentlemen, what I want us to do is the situation of the theft of a baby at the hospital. I believe that it's part of the general infrastructure of our health system. So, security at the post. I want you to tie that into what happened with the death of the gentleman because of a no-bed syndrome. And in 2 minutes, each of you, I want to say, what should we learn from this and how can we build forward? So let me start with you, Dr. Naba.
Thank you, Omar. Let me first of all send my condolences to the family of that young man who passed away as a result of inability of our health system to take care of him, and he passed on. And to say that that was very unfortunate. And I hope that government should be listening, and then I know they are listening. That is why there is some improvement in the health sector. We have infrastructure problems, like everybody has said. We have human resource challenges, just like everybody has said. We have lapses in the administration or governance of our health facilities and the health system in general. And we have to look at all these things. And that would, we add the finances, which I think it is getting better now, we'll be able to improve. Let me just give you some quick information. In Ghana, we have 1/3 of general number of doctors we need. So therefore, doctors will be exhausted.
We don't have enough doctors?
We have 1/3. We're supposed to have 32,000 doctors in Ghana.
So how can we have doctors
who have not been posted?
We have doctors who have not been posted.
So you see, the emergencies will be crowded. The wards will be crowded. But even with that, I still insist that the emergency protocols and guidelines should be respected to prevent people from dying. Coming to the lady who lost, they stole the baby at, is it Mamobi? Polyclinic. Mm-hmm. That is also very unfortunate. And I think that it comes to bring to light how our security system in our hospitals are. But I look at all this to be an attitude issue and culture issue of we Ghanaians. We don't respect visiting hours. We don't take command now. People don't even want to respect when they get to somebody's office, they want to do what they feel, especially hospitals, because they believe that, though in as much as I want to protect the citizenry and patients, they must also respect people who work in the hospitals, because if you are so exhausted, you at the same time trying to provide security, like it happened in Rich. They beat a security man for preventing somebody from going into the hospital because it was out of visiting hours. That theft of that child was very unfortunate. I think it is as a result of several factors. One, perhaps the tagging, wearing of tags and name tags on staff are not very good. CCTV cameras perhaps are not advantage points. The staff are not educated on how to enhance their own security and security in the hospitals. And then I think uniform. Sometimes some nurses come, some doctors come, and instead of wearing their coats and other things on top, they just wear anything and they are working. So if anybody also enters there, he may look like one of them and also go ahead. I'm not saying that is it, but I'm just mentioning some of the things.
Okay.
The advice is that let's see how we can bring a serious security management framework into all our health facilities. Okay. This is a call for us to wake up and then at least do something better for the security of everybody, including the staff.
Okay.
Yeah.
Dr. Okoboy, attitude of staff, lessons that should be learned.
I think quick one. There's this misconception that doctors, why are they managing hospitals and not administrators? For the information of the public, every hospital has a trained hospital administrator. They are not doctors. So all the government hospitals have people who are employed. They actually run the hospital. The medical doctor who is a med sup or head is normally like a, I don't want to say figurehead, but it's like the top management head. But every hospital management, which is a budget management center, they do their own projection of what they need and all that. It's headed by the doctor, but there's a hospital administrator who is the engine of the team in every hospital.
Okay.
Secondly, I think we should insist on some few basic rules. There should be no referral in any hospital without the knowledge of 2 or 1 top management member. And I'll explain.
Where the referral from or to?
Even from the hospital. So let's say you go to LECMA and they want the doctors at on duty at 1 a.m. If they want to move you from LECMA to another place, they should seek the input of the top management.
Why?
The reason is that sometimes if they have to seek permission and explain why, justify why they are moving you, because the justification might not be strong, they might be told to keep the patient.
Okay.
Sometimes the reason they will give can be handled by the top management. Get this from this guy. If it's oxygen, call this facility to bring you oxygen.
Okay.
So leaving those on duty alone without the involvement of the top should be stopped.
In the case of the gentleman for whom reason we are having this conversation, he was not even admitted into the system. Can that transfer also be said to get clearance from the top? So before you reject somebody, do you still need
exactly. So this case, for example, if you have that rule as one of the basic rules, it is possible that the top guy will say that, you know what, despite the oxygen flow, keep the patient, I'm calling my colleague at ABC to do an intervention. All I'm saying is that when people know that they must account for the decision about to take, they are more careful.
Okay.
And in fact, there has been instances where security men have told people that there's no bed here. You know, in some hospitals, because they've heard the previous case going because there's no bed. So when you get to the case, say, Master, there's no bed here. So if the facility is aware that before anybody moves out, the top must know, then it can sanitize the system. Second, let me also say that every district has a district health director. One of the things that they can help government to do, we can incorporate, is that they must always discuss the events that happens in the major hospitals in their district with key stakeholders in the community, like let's say chiefs, assemblymen and all that. When those working, especially public workers, and this is not only in the Ministry of Health, most, forgive me, the attitude in most public places is not like the private sector. But immediately they know that a light is being thrown on their works, people sit up. So events in hospitals should not be secret. There must be a quarterly review where they know they are sitting with people outside their sector. That makes people sit up. Like I mentioned, the maternal audit. The attitude of every medical worker is different when the pregnant woman arrives. Because you know that if this woman exits or dies, there's going to be meetings at regional hospital facility, district, and sometimes regional level to see what accounted for the death.
Answer questions.
Yes, so the attitude for such people is always different because light will be thrown at other areas. And then finally, let me say that although I was at Ministry of Health, there were occasions I went to Interior Ministry to ask them why the police hospital structure has stalled. Look, police people like soldiers, they can't complain. But I'm telling you, the police hospital over there, even a 3-bedroom is bigger than the police hospital over there. The police hospital here is just some two small rooms. You see, don't do the politics. You see, I'm coming, senior. You see, I'm coming. The police hospital project was stalled when we came in. It has gotten to a point. When we came in, in fact, the reason I went to ask questions is that when I was a member of parliament on a health committee and not a minister, I went to the health minister and said, Minister, this facility, where it's positioned, is very strategic. And the police we call it in case funny cases that other hospitals will avoid, because let's say a madman who's been knocked by a car, if If you take your facility, you know that it can be bad debt. Police, by their nature, normally take such cases. So I've been an advocate for the police getting their infrastructure complete. And I went to the health minister. I said, look, it's under Interior Ministry. The project is not being handled from health. But I was looking at the services to deliver. So I went to see the Interior Minister under us and said, whatever problem there is, resolve the problem.
Because you are the beneficiary.
Exactly. There are contractual problems. Senior, with all due respect, this country is a continuum. You know, I see attitude from some people when they talk, but you were there. Before MPP came 2017, Ghana was not having. People have ruled, there were challenges. So let's see the thing as continuous. The amount of effort you put in will be used to judge you in the next election. So do your best whilst you have the opportunity. That facility, whatever the contractual issues are, should be resolved. How can we be a country and have a structure which has stored for close to 9 years? What is our problem?
Same with the General Hospital.
No, at least for La Honorable Account, let me commend him. He's my brother. I went to him and said, Honorable, let's try and push this thing. And he's engaged the contractors, and thanks to him, I've seen some action over there. It will help with giving more space. Okay. But for police hospital, and you know, it's because beyond population size, there is density. The highest density is within the ministry's area. Yeah. Everybody comes to do activities here. So as for police and La General, they are facilities that we must definitely try to complete. Yeah. Finally, I think Ghana here, Umaru, I've worked with the Ghana Service. When I first worked with the first government facility, I don't mention their name, I was one of the most hardworking doctors. But because I didn't know this Ghana culture of going to a big man's house, the hospital boss, to be a friend and all that, I was not a fan of the bosses. And it got to a time I was nearly even victimized. In this country, they don't reward hard work sometimes. So most of the hospitals we have, you have a head of facility. It's not because they have proven track record anywhere. Either they are a friend of someone who has come to power, or they know the regional administrator. Let's start to now have some basic threshold for every leader, every head of public facilities. If you are in charge of, let's say, a polyclinic, and every day funny things happen there, why are you there for 5, 6, 7 years? You see, we are not, forgive me, professional in even giving positions to people. And it has happened in the past. Unfortunately, it happens even sometimes now. Someone has been moved to some big hospital. When you go and check, he doesn't have the capacity. But you go and check and see that his brother is maybe a minister somewhere. So let's look for competent people to run our hospitals.
Thank you so much. That's Dr. Okoboy speaking professionally as a professional. Yes. Charlie, thank you. Thank you for.
Today, I wish he was there when they were sacking me.
Today, because of the panel, it's safe to talk as a national.
Yes. Otherwise, if you try.
When I was being sacked.
Dr. Anaba, he was there when you were.
No, he wasn't. He's my friend.
He was there, but in the shadows. He was there in the shadows. Let me hear from you.
In fact, I've listened to you. Most of the time you speak as a nationalist. I just think you should speak more. Unfortunately, the house you are from, the familiar spirits are so powerful that if you talk more about Ghana, you create more news for yourself. But we are behind you. Yes. So continue speaking for Ghana. You see, and I think, and I'll follow from where my brother is about the culture in this country. We need to change our attitude. We need to have a culture that is more patriotic as against being parochial. We need to have a culture that once again values human life. So during the last elections, when we were about signing the social contract with whoever will become president, because you see, sometimes we give the ministers too much power and also too much blame. Because as a minister, you can come out with all the beautiful policies. If your president does not support the policy, and when I say support here, not just by financing, because the power of fiscal policy is in his hands. It's not in the hand of the minister. All you can do is write some policy. It will go to cabinet, will meet. But if the president does not support that policy, forget, nothing will happen. And that's why, in my opinion, who we choose as president, because the executive power is placed in his hands, is very critical. During the last elections, we were listening to the people who wanted to be president. Only one leader, one of them, spoke about changing attitudes, impacting the culture of Ghanaians, because that's central to everything. That's central to everything we do, our culture. We don't have a culture that is based on merit. And we heard a doctor say, and I'm sure people say, I was. But we need to create a culture that's based on merit, because in every country, you need to use the best in the country to create the systems for all of our benefits. So if the culture here is based on who you know, so that it doesn't matter whether you can do the job or not, you'll be placed in a sensitive position. You will die. Because if you're unfortunate and you go and face such a person, you understand. So, during that, we had the opportunity. We had a leader who said he would do 6 major things. And one of the major things was to grant leadership that would change attitudes. And he said he's moving for change.
No,
so we don't want
Mama said he'll give you some appointment at is it
no,
or
see, that's not the issue. We had somebody.
So don't worry. The other leader said he'll give you.
It's going to change Africa.
Yes.
We had a leader who, amongst other things he said, said that, listen, one of the things I want to use my leadership to change is the attitude in this country. Also, we just don't respect.
Now that he has not got the power to do it, tell him to join.
No. That's what we are advocating. We are still
join NDC.
No, we are UP. That's why we gave our blueprint to His Excellency Jomama, and
he's implementing some of them.
So you see, to follow from what we ought to follow rules. You understand? Okay. And sometimes if we struggle to follow rules, that's why we have leaders. We ought to enforce the rules. Because we all go to the hospitals, like I'm saying, they have their own procedures, that their SOPs, they have their rules, and people simply don't follow them, and they'll continue to flout those rules because when they flout them, there's no consequence. And like Radley was saying, we take accountability from anything we do at whatever level. Then, Umaru, I'm afraid there'll be a cycle of failure.
Thank you, Council. Dr. Norman, let me hear from you.
Okay. First, I like
lessons we should learn, attitude, how to deal with that.
Yeah. And then the baby theft.
Theft.
I'd like to thank Dr. Anaba and Dr. Okoboy for their professionalism and objectivity.
This morning.
It's quite refreshing, and I'm learning a lot from them. I appreciate that. And of course, my brother Andrew, I'm also learning. I think that the baby snatching, I want to tackle the baby snatching. It's not, it's an event of low frequency in Ghana and in most countries, right? I tried to look for data on how many babies have been snatched from any hospital in Ghana in the last 10 years, and there is no data. In 2024, with the help of 2 ministries, I did a study on subjective security in Ghana for those ministries and presented the outcomes to them. We noticed that the penetration of CCTV camera in Ghana is less than 12%. So you cannot blame just the hospitals. There are many, many critical businesses that have no CCTV cameras. In terms of care for children going to school, in many, many cases, less than 20% of children between ages 12 and 5 have a chaperone leading them to school or being bused to school. So the risk issues are very, very many. My sympathy goes to the couple whose baby was snatched from the hospital. But the phenomena, I think we are overblowing it. Ghana is safe for every level, age cohort, and that this is not a high frequency. The incidence is quite low. But the moment one happens, because a baby is involved, we blow it out of proportion. I am very happy that the Minister of Health was there, that the regional minister was there to comfort the family. But mothers and fathers, your children are safe in this country. But the duty is upon you, especially when they are going to school. Make sure they are being accompanied by an older person, because you cannot have such young children walking by themselves. And one of the questions that we asked in that study is, are those children between ages 5 to 12, are they using roads or pathways that are quite common and popular that everybody uses? And they said no. They use pathways that can maneuver their way very quickly so that they pass places where nobody else is there, just so that they can get to school on time. So for me, the security issue is not just in the hospitals. It is everywhere. And so the government of Ghana cannot be expected all of a sudden be spending a lot of money on everything. The critical issues is that the security, the human security, the watchmen at the gate, they should be a bit more vigilant. The nurses should be also a bit more vigilant. I wish that this country will have a policy that the nurses' uniforms can only be worn on the premises of the hospital. That they will not be wearing the nurse uniform, an aesthetic nurse wearing a nurse uniform, sitting in trotro, and then the same uniform, is infested with germs.
They don't have changing rooms.
They don't have changing rooms.
So you can't.
They have changing rooms, but the government doesn't want to provide them. They give them the uniform, but they should come and change there. And if we have that, you will not be having these kinds of. The doctors are laughing.
They are laughing at you. Let me hear why they are laughing.
But you have changing rooms.
It's just that some of them want to wear it and get sympathy from travelers so that they facilitate their way home. They give them some lift quickly, or they get the trotro.
So the problems are multifaceted. Transport problem.
Yes.
Because if there was a bus that
uniform, you get some sympathy from.
If there's a bus that will pick you from Ridge Hospital to Tertiary, there's no need for you to do sympathy. But you have to go and stand in a queue and beg.
Yes, so sometimes they do it.
This country.
So how about changing room we have, please?
All right.
So please conclude.
Yeah. So for me, I think that the issue, it can be controlled by policy.
Yeah.
The hospitals can control this. Don't wear the nursing uniform outside.
Okay.
You only wear it inside. And in terms of security, the hospitals that have money, they should put in the CCTV cameras. But if it's a large place, you need about 50,000 cities to do the CCTV coverage. It's expensive. When your X-ray machine is broken, you're not going to buy a CCTV camera. So you see, sometimes you should have some sympathy. But the incidence of child snatching in hospitals is quite low. Quite low.
So it's not a regular thing.
It's not a national security issue.
Yeah.
At all. With all due respect to the incident that had happened.
I mean, I have personal experience from Kolebu Teaching Hospital, where a mother and the new baby, they will not let you go out. The security guys are down under the lift there. They insisted on taking the paperwork before they let you go through. So, but my mother told me that when I was born, I was stolen in the hospital, but she found me. So
you should have come to me.
That was many years ago. I would have been Umaru.
What was that?
Let's leave it. It was many years ago. It was many years ago. My mother is the one who reported it to me. I don't know. Anyway, let me go on Zoom and speak to Dr. Sapon. Dr. Sapon, are you still there?
Yes, I am.
So I wanted quickly in just a minute, what lessons we should learn from this? What attitudinal changes should be there? Do we need a new law? What do we do in moving forward?
No, we don't need new laws. Like I said, we know what our problems is. Again, Dr. Norman has said that snatching of babies is a very low incidence activity, and that is true. But again, I'll refer you to analysis of reproductive and maternal, newborn, child, and adolescent health indicators from 2019 to 2024 report, released in 2025. It tells us we have a security risk in our maternities across the country. But you see, like Dr. Norman said, we wait for it to happen, even though it's low risk, we've been told. And if you listen, the minister in one of his visits had also said that for hospitals where there are CCTVs, they should be in active use. And for hospitals, every health professional should wear their uniforms. The question I ask is, in the hospital where it happened, were there CCTVs and were they in use? And were all professionals wearing their uniforms? That's something that the committee that has been put together must investigate. Because the reason I'm referring to the reports is, I don't expect this investigation to lead to a new report, which also gets shelved, like all the reports I've referred to, because everything we are discussing, we've actually documented before the incident happened. But we are discussing it today as an incident. So I ask myself, what is the value of the diagnosis we do of our health system if we are not going to use them and allow poor outcomes? So for me, these two incidents should be investigated thoroughly. And the reports that come out should be implemented without fear or favor. If we do that, we would be shifting from this chronological activity of writing reports and shelving them. And unless we stop that, we would hear the likes of Dr. Norman, who do a lot of these works for the ministries and help even multinationals do some of these reports for us, tell us that they knew these risks were there. And then for listeners to sit and say, but if you knew these risks were there, what did you do about it? And we would be in this vicious circle until we change that attitude. So for me, the issue is about investigation, learning, and if we do it properly, we would realize that even the staff, a lot of the guidance that Dr. Anaba was talking about and other things, they probably have read them or may have not. But they are not practicing them, including the SOP, because a lot of them are not doing their continuous professional development. And that may be at the heart of the problem. And the fact that the managers of our health system are also not ensuring, as well as the regulators. Someone comes and says, I've done my continuous professional development, so you issue them with real licensure. But you don't actually check. And I think that's what the problem is.
Okay.
Thank you.
Thank you so much. Let me go to Franklin. Franklin, I want you to start off the conversation on Burkina Faso for me. Tomatoes, for the hunt of tomatoes, we've lost 8 lives. I don't know that you want to look at it from our agriculture point of view as a country where we are not serious, or you want to look at it from a security point of view where the threat has come home, even though from a distance.
Well, thank you very much. By the way, I'd just like to say that if you can hear me well, look, accidents do occur, and I can understand what had happened in Burkina Faso was nightmarish. To think that the actors involved, the tomato sellers or tomatoes, didn't know about the challenges in Burkina Faso, I'm sure that would be a lie. I think, yes, indeed, maybe there are some security lapses in terms of maybe emphasizing the point that, look, Burkina Faso is a risky place to go to, and making sure that the two governments work together to protect farmers, farmers or whatever, those who sell, just about anybody who wanted to go into those areas anyway. I'm still waiting to hear what exactly was the security failure in this regard. But let me just say that, look, at the end of the day, whether we like it or not, I mean, we've always quarreled with this whole idea of buying certain food staples from across the borders when we could have been growing some of them here. I mean, it's a tired debate, it's a tired argument. At the risk of sounding very boring, I'll just say it again. I mean, if we had invested wisely in the Polugu Dam, or even most of these industries that we love to mention as Nkrumah bequeathed to us, I'm sure we would not be where we are today, So it's a bit worrying.
The Nkrumah that you don't like, Franklin.
Oh, no, I'm not saying Nkrumah. I never said I didn't like Nkrumah. I'll just say, what I said was that some of his actions obviously had to be questioned. And I think that Nkrumah was his own nemesis, by the way, because he had everything to do to change the narrative back at home. Anyway, let's not start that debate. Just to say that, look, at the end of the day, even if Nkrumah bequeathed Commander to us, the way we even invest in Commander, right? We all know in the 1970s, about $90 million was needed to bring it to full stream. In 2020, is it 2022 or 2023? We were thinking that some 30 million can revive it. It did not. In fact, in 2017, I think the NDC started, right? We're thinking some 16 million or 20 million can revive it. It did not. Our own Alan also tried. It did not. But the data is there. So we may blame Nkrumah for starting it, but at the end of the day, the same governments have done nothing to really go ahead of it. The same thing with tomatoes, right? I mean, what does it take to grow tomatoes anyway? I mean, you have land, you have just making sure that agronomic practices are respected. But we have ministers upon ministers who promise heaven and hell, not hell sometimes, but almost heaven, that will fix stuff. At the end of the day, they become market men trying to sell food stuff at the Ministry of Agriculture. And I think these things have to be brought to a head. I hope that this 24-hour economy thing that the Guzi is trying to do, which I've seen part of it has to do with value chain investments and all of that. And it's some integrated approach to doing this thing, transportation, storage, and more important, processing. We should do things that we know can be done. Otherwise, we keep on going back and forth. And by the way, the Burkinabe thing had nothing to do with the so-called Ghana government getting closer to the Burkinabe government. But rather, of course, there are internecine squabbles all over the place within the West African area. And it has to be dealt with holistically. I'm sure Norman will tell you more than that.
Actually, so I was going to come to Norman. Thank you, Franklin. Dr. Norman.
Yes.
Burkina have their problem with their own terrorist people. Mm-hmm. And the minister, when I interviewed him, said that the people said, we know you Ghana people, we don't have any problem with you. And yet, they shot and killed and burnt their vehicle, burnt their bodies. How did we become victims of a fight that we don't have a hand in?
Yes.
And are we safe?
We are very safe. I have previously theorized that during President Mahama's first term, he accepted the 2 Guantanamo Bay prisoners. And even though Ivory Coast, Burkina Faso, and Togo were attacked, even at the border, the fringes of our country, they left us alone. But so when the Honorable Dominic Nitiwol, someone I respect and like very much, said that it was because we have moved closer to President Ibrahim Traoré, because President Mahama, he attended his inauguration and all. And because of that, the enemies of President Ibrahim Traoré see us as his friends, and therefore we are enemies. And I do believe that we cannot discard what Honorable Nitiwo said. My theory has proof of concept, what has been actually been given by Honorable Nitiwo. I think that the message that we should send to the JNIM group in Burkina Faso or ISIS, whatever they are, is to reassure them through whatever means possible, track 2 kind of diplomacy or whatever, that what the relationship that President Mahama is obligated to court amongst the Committee of Nations within the West African region has nothing to do with support for the internal affairs of Burkina Faso, but rather it is a regional duty for regional security, international diplomacy, for him to do that, so that they wouldn't attack us again. The fact that they knew that the people were Ghanaians, they were speaking English, the truck had Ghanaian license plate, they allowed them to go for the goods, and on the way back, they attacked them. Means that they were not interested in stealing from them, as some people have theorized. They were not interested in looting their goods. They were interested in sending a message to the government of Ghana to be very careful.
What's the message?
The message is that mind the way you are going towards, you're giving him legitimacy. You're making President Ibrahim Traoré too much legitimacy. Mind the way you deal with them.
But the terrorists or the insurgents in Burkina are not questioning the legitimacy of Traoré as president or government. I think they want to take over the whole country, regardless of who is leader, right?
Well, it's part of the legitimacy. So the more he is accepted into the Committee of Nations, the stronger he becomes at home. That is the legitimacy. And so if they can do something to send a message to the government of Ghana, they will do it. If we don't pay attention to what has happened and just discard it and dismiss it as if it's some kind of profiteering activity that they were doing, they will enter Ghana and they will attack us within the country.
So this,
I'm very sure of that.
So this is a warning.
It's a warning.
How should we react to this warning?
That we should increase our surveillance system. We should tell our traders how to behave. No, don't go into enemy territory. And if the buyers, the sellers of the tomatoes in Burkina Faso can bring it to the safer areas, let them do it. But don't go over there. Even though the cost is going to be a bit higher, do it that way. And the government of Ghana should increase informal diplomacy with the groups as part of trying to bring about peace in Burkina Faso.
So we should stop inviting Traoré to our independence square where he gets the loudest applause?
No, that's not the approach. The approach.
No, so I mean, should we cut ties with him?
No. He's a president of a state with which we are neighbors.
Yeah, but you said that we are being warned by this attack. And if just warning, 8 people are gone, and if we don't listen to the warning, they would come more, then we should start dewoofing.
There are some strategies that I don't want to sit here and discuss it.
Okay.
But I think the government it has a group of people, intelligence level, that it should be intelligence-led strategy in dealing with the elements outside of the official government institutions.
Is that Bevlo Late's mandate? That's what Bevlo Late is supposed to be doing, right?
Some of that, yes. Okay. So I believe that the government is very much aware. Don't take our government for granted. They have very competent people advising them. But there are certain things they could do to improve informally the relationship between all sections that are at war or at disagreement in Burkina Faso. You shouldn't pick sides, because when you don't also include them, engage them, you can become even a peacemaker when you also engage all sides of the people in conflict.
So we should not fight the terrorists, we should not fight the Burkinabe government, we should just be careful.
We should fight the terrorists within our territory.
But we shouldn't pursue them out there, even though they have attacked our people out there.
Major General Emmanuel Kotia, has done a very good job when he was at the Boundary Commission. And they did a very, very good job. I admire that man so much. We should continue with the kind of diplomacy he was applying. When he brought the Ivorians to Ghana to agree to the boundaries, I said, my God, this man is an asset to Ghana that we should honor him every day. Because by so doing, the Ivorians will respect the boundary line. Now we are being sued by Togo.
We are rather taking Togo to the
we are taking Togo to the maritime court. These are some of the things that he was trying, Major General Emmanuel Kotia was trying to avoid.
Okay.
So I think there's a lot that we can do. They shouldn't let him go on retirement. They should bring him back and get him. No, seriously. Elements like that, even if they go on retirement officially, they should be engaged as consultants.
Very well. Okay.
Thank you.
Andrew, Burkina Faso, should we, and your leader, what is his view on agriculture, so that maybe that could have prevented our people from even going to Burkina Faso to have been...
You mean UP?
Yes, UP.
Okay. Yeah, so I think it's pretty much clear. I think it was in the Great Transformation Plan, the ILO...
The GTP.
Yeah, the GTP. So when it comes to the issue of agric, Tisal in Ghana, we've seen agric as a subsistence activity. We don't see the economy of agric, and we don't see the economy of agric. And so, in terms of agronomy, in terms of research and development, in terms of finding a strategy at giving financing to the farmers, and also in terms of the supply, as in the supply chain, so distribution, and we have not been able to fashion policies that will cause us to maximize gains in agric. Because unfortunately, we have very fertile land, and so just the planting and harvesting really shouldn't be a problem. But how do we see agric here? As in, we don't see agric as a business, and so we just plant just for myself, and because of that,
even though we had plenty of food and jobs,
yeah, sadly.
But now we have other things. I think we have some agricultural interventions by this government.
In fact, I must commend this government for institutionalizing the 24-hour economy.
The way I'm commending this government, if you're not careful, by next week you join the government.
No, I'm not part of the NDC, but as a where
you're over commending the government, I'm worried for you because
don't worry, because you see, during the last regime, we had free SHS, which was a fantastic idea, but they failed to institutionalize it. So you saw the chaos in the implementation, and I'm guided by history here. So you go to the history of the US, after the Second World War. And we must recognize that the Second World War came on the back of the Great Depression. So there was about a 2-decade period when the American economy was tanked. How did they come out of that quagmire? It was by law. So you had a President Dwight Eisenhower, who enacted or who pushed the Small Business Act. The Small Business Act created the small business agencies. And their focus was to give both technical support and financial support to small businesses. And by that singular act, institutionalizing that idea that SMEs can be the basis for restoring the American economy, we have all seen the transformation that occurred in America. Now we have an idea to expand, to transform both agriculturally and then through what's called econs, because really that's the focus of the 24-hour economy. I hold the view that the 24-hour economy will be a natural consequence of some policies. But they've gone ahead and not just stay at the policy of it, but they've institutionalized it. It shouldn't matter whether I'm not an NDC member or not. I'm a Ghanaian. And if this works, I'm going to benefit. So I must commend them for making a law, creating an authority, and giving them clear. Because see, when they do it well, the fact that there's a law, first of all, will facilitate the ability to implement it well. And once again, I'm sure they took it from a great GTP. But if they took it from it, it's all the same. We are all in the business of creating what's called one Ghana. Yeah. But for us as UP, we believe firmly that agric, and we must see agric as an economy. Really, because when we talk about econs, we are talking about production and consumption. Immediately you see agric as the economic side of agric. Then as a state, you put in place policies, you put in place institutions. That one will not only give the farmers the technical support, but also the financial and institutional support. And by so doing, you encourage more of your citizens to then partake in the economy of agric. And you see, and when you take the entire agric chain from when it is produced to when we consume, there's a business at every single stage. So there's a business in the production, but there's also in the business of the consumption, and that would mean that's what you must, as in the supply chain, because there's logistics, there's and all. So when you read the 24-hour economy, they give you the three pillars. The three pillars being productions and transformation there. They talk about expanding the supply chain, because there's also a business there. And then they talk about then enhancing the labor, because those are the three thematic areas. And in every bit of it, you can make an economy out of it. And that was the vision of the UP. Okay. You understand? But having said that, I think if there's a time in the history of Ghana and of Africa for us to push a united African agenda, then the time is now. So you see, we've sat down before that, this jihadist attacks on our brothers in the Sahel area is their problem. It's not our problem.
It's getting home now.
No, but because you see, it is our problem. Because they are number one trade partners. If there's any instability there's instability. And that's why some of us had an issue with Nanado, aka Nebu, for how he handled the diplomacy, the West African diplomacy, to think that Ghana, a country that has been at the forefront of the Pan-African agenda, Ghana, a country that led and even created that union, Ghana Union. Ghana will be at the forefront of the agenda to mobilize forces to attack Guinea and Mali. You understand? And once again, I know you say that I'm still UP, but the idea that, listen, let's create an envoy to find a way of creating that diplomatic relationship between Ghana and Guinea, Ghana and Mali, and Ghana and Burkina Faso. Because in fact, when you talk about Burkina Faso, they are essentially our brothers. Because you talk about Yenika. Yenika comes from the same stock as the Dagombes, as so you understand, we are essentially one people. And so that when you attack Burkina Faso, you are essentially attacking Ghana, you understand. And so for us, let us take our position once again as a Pan-African leader, lead this agenda to have real unity. And when I say real unity, the kind of unity Kwame Nkrumah envisaged, the unity that was ready to cede a bit of our sovereignty. Then we can have then we'll have one force, and with one force we can deal with the threat of this. You understand? Right. So for me, I agree with Doc here that yes, we must handle the diplomacy, but the handling of that diplomacy does not mean that we should be afraid to even battle or go to the aid or lead an agenda to bring all of us West Africans together to deal with this jihadists issue.
Dr. Okoboy, the free movement of goods and services, we can't say that don't go and trade in Burkina. Yeah. We said that we are part of the protocol, let's allow it to flow. And yet these things that has happened. So I don't know whether you agree with Andrew. Should we say we are going to raise an army and go and help Burkina to fight so that we are all at peace? Because if one is not safe, we are all not safe.
Umar, respectfully with all due respect to my brother, sometimes when we speak, because sometimes it sounds a little bit emotional, you might think that, with all due respect, under the 8 years of Akufo-Addo, nothing happened. Yeah. But if you take a Greek, I was in Parliament, when you take the budget, you can go to the appendix and watch every sector and the growth that happened there, using realistic tools, scientific tools. And when you go under the 8 years, you will find some sectors, fisheries, agriculture, some parts that experience some improvement or growth compared to even the past. So a leader might have his challenges, but it doesn't mean that all his activities or works were below par. This is scientific. So I just want to put that across. Okay. Now, if you also study economics, the 10 principles of economics, trade makes everybody better off. Yeah. All the scientists and theorists show that no country can try to attempt to produce everything. And that's where the principle of comparative advantage comes in. What are you good at? With what product would you put in the minimum time and get the greatest output? Why do you want to start producing planes when, let's say, to take you 1 year to produce one plane, but Boeing would take, let's say, 3 days to produce one plane? Their plane will be more cheaper than yours because they are more effective. So, as for, we should not change, we should be careful not to move the discussion, which is actually a security issue, to trade and say that if we had even built a dam during someone's time, this will not happen. No, you have security issues. So talk about the security issue. Now, in the past, traders went into those territories with rebels, but they even sometimes engage them. They realize they are from Ghana, they let them pass. Then later, they kill them at another time. Obviously, you should know that something might have gone wrong, like Doctor is saying. Did our security agencies pick that from their assessment, security assessment? If they did not pick, let's have an objective committee to look at what went wrong. That's how you can be better prepared for other events.
Where we are targeted this time.
Exactly. Apart from the northern border, you have other borders. Where Elubu, it's possible something can go wrong in Elubu, but what you learn from this would save you in the future. Mm-hmm. But sometimes people get too quick to get into politics. The fact that this has happened during NDC start doesn't mean that they feel so miserable with security. Yeah. But some will go like, no. Even if we had even had Pualugu, they will not go there. If you even have Pualugu, somebody will go and buy, let's say, another item from Burkina. Mm-hmm. So what is the assessment? What happened? Secondly, you see, these Burkina leader stuff, I wouldn't say that I'll go with it 100%. Need to my senior brother. But bottom line is that we must have some fundamental principles and baseline. You see, you can have a position as a country, which is a good position. That look, if you're a government that came out of a coup d'etat, we generally don't approve of governments that are coup. It doesn't mean we act antagonistic. But behind the scenes, you can be engaging. So we should not also blame a president or a government that says that on the surface, if you're a product of coup d'etats, you cannot sit at a table with us. But it does not also mean that behind the scenes, you don't engage. Okay, so the behind the scene is allowed. But diplomatically, you want to be consistent. And the danger is that if those who came through force are at the table, those who are civilians, their future is not guaranteed. If I'm a general in Ghana and I've realized that there are meetings in ECOWAS and half of the people are military generals and they are all drinking tea and it's normal, I might think that why don't I also take...
So that also become...
Exactly. So it's an exercise in self-preservation to say that this is not our stuff. But behind the scenes, normally, you have to engage. So that is an approach that we should understand. Okay. And the way this gentleman was received when he was invited, I don't think President Obama created it. People generally youthful. Oh, we like the guy with his gun and all that. But I don't
the loudest applause when his name was mentioned.
Yes, I don't also have any evidence that it is that is actually causing what happened. But look, the truth is that in this world, the more experienced you become, the more you realize that some things that look exciting on the surface are not really exciting. Exactly. Umaru, look, a young person can shout because a soldier has a gun over there. But if you've read through civilian military governments, there is no way you are safe or better off with someone in uniform.
But it's a question of the democracy we are running.
No, I know.
So, it's almost as if people are fed up.
You see, when you have tested an experiment and have the results, it should never be an option, even when the one that has challenges you are working with is having challenges. Work on the challenges of the system. Like Kweku Baku say, as a general principle, it is only a coup against another coup that I support. Only that, a counter coup. But beyond that, there is absolutely no way. And you know what? Let me also now say quickly that as a community of nations, we should also help to try and stop or discourage governments that increasingly become dictatorial. You see, when you have a situation where a government that started as a civilian government, over time, is silencing all factions. If you read Why Nations Fail, a very good book, it takes some sudden traumatic events before you can remove such despotic leaders. Either a coup or a revolution, like Bangladesh. What happened in Bangladesh? It took Gen Zs to say that, look, this kind of system cannot stay. And when they went out the streets, today they now have a changed government. So the point I'm making is that I'll not cite a country, but there are some countries in West Africa. They started well. Over time, leaders are becoming entrenched. It's like they are going beyond their limits, and then they are using other tools. They are changing the constitution. I will not mention. I'm a diplomat.
I've helped you.
But Umaru, as you do that, you know what happened? Forces that would have been active in a democratic regime are now becoming suppressed. They start thinking of other ways to get you out. Because I don't support a coup, what I support is for other nations to be bold and say that don't do this. Okay. Why is it that your constitution said you should do, let's say, 2 terms, and you've succeeded in going to parliament to change it 3 terms, and going to 4 terms? Now, once you are becoming a despot, forces that we don't support or moves that we don't support, they are likely to happen. But if the community of nations stands strong, then we prevent those upheavals. So I think the politics should come down. Look, our security is very good, our system, but they are not perfect. When something goes wrong, let's do an assessment, find out what happened, and improve.
Dr. Anaba, your constituency is almost near the border to the north.
Yes.
I'm sure business between your constituents and Sankansi people in Togo would be regular.
Yeah.
So free movement of people across the border should not be a problem. But this particular incident, I believe, has shocked everybody. How do we deal with it moving forward?
Actually, it has shocked us because, some of us, we have our relatives across the barrier. Kusasis are in Ghana. We have Kusasis in Burkina.
Oh, okay.
Oh, yeah, they even teach it in the university.
Just like Moshi people.
Yeah, just like the Moshi people. We have Moshis in Ghana, we have Moshis in Burkina. We have Bimobes in Ghana, we have Bimobes in Burkina and Togo. Okay. So we have family relationship in those countries. So this came as a shock because there was no warning signs. Actually, the security aspects are here. To say that the president invited Tuareg, that is why it is not. That one, I don't take it. But there wasn't any warning sign that there could be problems because we even have more serious problems, even within Boku. Even in Burkina, just that now it is coming down. My question is, why did the people go there? We've all spoken about it. They went there because of business. No country can live as an island. We can't produce everything. Can we do something to minimize that and also leverage on our natural resources, our natural land, to produce such things to minimize the number of people who go there and give jobs to our people? Yes, we can do it. My friend would not like me to mention it. If we dig dams, if we develop the dams, the Garu Tamne Dam.
They left it down for you. They did one village, one dam for you. Plenty.
The Tamne Dam, if they had finished it like by now, if planting for food, things would have improved. So it is not that somebody wants to play politics with it, but the one people who raised the issue even in parliament played politics with it by blaming a government when they didn't have the real reason why the attack occurred. They were blaming the government for not preempting. Who would have preempted it? Even the best security person could not preempt this. If these things could be preempted, America wouldn't have had 9/11. They wouldn't have 9/11. And to say that, because he's a coupist, we don't support him. Let me tell you, America just did a coup in Venezuela.
No, they didn't do a coup. They abducted.
It's a coup. America just did a coup in Venezuela.
They arrested a drug.
So that is a coup. No, look, we're talking of diplomacy. That is not, it is clear, it's a coup. To take a president out and fix somebody in, it's a coup d'etat. That is America for us, and we all acknowledge it. How did Touareg come to power? He also came to remove a coupist. So this is a coupist you should support. This is a coupist we must all support. And the reason why some of us think that Touareg came to power is because in Africa or in the world, to be able really to fight neocolonialism, the democratic leaders are failing us. We all kowtow to the West. These three young men have come to Burkina, Niger, and Mali to try to nationalize their resources, especially Touareg. And this is what we must look at. They are our neighbors. Ghana attempts even to sign a contract to ensure that we benefit from our oil. We shiver in our pants and we take some peanut percentage and give the Western companies very large percentages. They have come trying to curtail all that. Why are we having terrorists in Burkina Faso? Were they there before? When Compaoré, what is the name of that president who was the Blaise was there when we were having terrorists?
Blaise Compaoré.
Because he was pleasing the West. And we all know it. He was pleasing France.
He stayed for over 30
years. Now that somebody has come and is not pleasing them, you see terrorists. Where are they getting the weapons? Do Burkina Faso manufacture weapons? Where are they buying it from? You are a security expert. You can tell me. But you can just see that, look, the whole issue of the terrorism in Burkina, if we think that they are not, we should deal with our fearsome and leave Burkina alone and don't play underground or however we can do it to ensure stability in Burkina. We'll also end up losing the same support.
So what should be our level of involvement in Burkina?
Our level of involvement should be like the Arabs when it came to Iran. All the Arab countries stood up and said, no war in Iran. We won't give you space to fight Iran. We should also get up as West Africa, as Africans, to stand up and say, we won't give chance to people who wants to overthrow leaders who are patriotically serving their people. Though he's not democratically elected, I know I was democratically elected and I like democratic government. But this guy has even proven beyond doubt that he's far better than some democratically elected presidents in Africa. Let's see how we can convince him to win him out of the military rule and go to what? A democratic rule. Like they've done it. Is it Guinea-Bissau or where the man has changed? What is his name? Is it Guinea-Bissau?
Yes.
He has finally gone for elections. Let's see how we can win him off the military position he's holding to a democratic rule. Rawlings did it. He came under a coup d'etat, but finally transitions to another. So I'm thinking that we should not abhor such people. Me, I am somebody who abhor neocolonialism. And I think that the gentleman is doing his best to ensure that his country benefits from what they have.
Very well.
If we are doing our best in Ghana, the only thing we need to do as West Africans is to try and have a round table and be factual, tell the truth to our colleagues. We have some presidents we have seen elections come on and people have been beaten, people have been killed in West Africa here, but they are still presidents. eight people died in Ghana, but people became president, isn't it? Is that democracy?
Thank you. Let me go on Zoom. Dr. Sapong, are you there with me?
Yes, I am.
Now, this week, we saw the news from the Ministry of, or the government spokesperson that Jean Mensah and Kissie Jabin would keep their post because the Chief Justice did not find any prima facie evidence against them. You are with CDD. You look at the democratic institutions and how they are doing. Should we celebrate the executive and the government and say that, well, when they removed the former Chief Justice, they were constitutionally correct, and so if they've done this one, then it's a tap on the shoulder. I just want you to use 2 minutes for that because we have to.
Yeah, you see, we have a constitution, and the constitution tells us how people in such positions are taken out. I've always asked the question, and I have always declared my position that I was never comfortable with the former Chief Justice being taken out, albeit I cannot pinpoint any constitutional provision that was broken, but I just felt the optics didn't look good. That said, I also have had serious concerns about the current, and a lot of us in CDD have spoken about our concerns about how the Electoral Commission has conducted themselves including the chairperson and their deputies and all that. Serious concerns. But at the end of the day, our concerns, whether right or wrong, need to go through the constitutional process. The constitutional process was triggered by people, including my friend Martin Kwebu. And the framers of our constitution in their wisdom said when the process is triggered, it has to go to the Chief Justice. It has gone that course, and the Chief Justice has come to his conclusion. He has forwarded the conclusion to the President. The Constitution says the President shall act in accordance with his conclusion. The President has acted. For me, that's the end of the story. Same as I've said with the former Chief Justice, the President was, whether we like it or not, was just a conveyor belt. You can say all you want about the President's probable intentions based on what people had said about the former Chief Justice. But at the end of the day, it was clear. It goes to the Council of State. The Council of State then makes a determination, comes to the President sets up a committee, the committee comes to their conclusion, the President shall act accordingly. In both situations, the President has acted in accordance with the Constitution. So yes, on that occasion, I'll say that you cannot help but give the President a tap on the shoulder, albeit that I had my concerns with the removal of, what do you call it, of the former Chief Justice.
Okay.
Yeah, so that is what I'm saying. Unless we want to say, like happened in the past, that the President would not comply with the provision of the Constitution when petitions are issued and not forwarded to the appropriate quarters. If that is what we want, then we do not need a Constitution. Then I'll go with what Dr. Anaba just said. We do not want a democracy to start with.
Yeah.
Because the provisions of our Constitution, which are the underpinnings of our democracy, even when followed by our President, we would have a problem. So we might as well have, what do you call it, someone just sit down and lord it over us. And I don't want that. I am strongly against that. So I cannot help but applaud the President for accepting the findings of the Chief Justice.
Thank you so much. That's Dr. Sapon. Franklin Kujo, Imani Africa, your position on the Electoral Commission chairperson, the attempt to remove her and the special prosecutor, and the verdict that has returned. Do I have you, Franklin? Okay, I don't have Franklin. Let me bring it. Okoboy, you people were saying that NDC wants to remove the Electoral Commission chair just like they removed the CJ. Right now, they're she.
Omar, you know, to be very honest, if your intention is known and an activity justifies your intention or it's in harmony with your intention, it's difficult to more or less exculpate yourself. The NDC in opposition were clear that because some judgments from the Supreme Court were unanimous, it was a judiciary that was now compromised. You heard this in opposition. They said it everywhere. To the extent that the NDC met lawyers that were sympathetic to their cause and told them that there will be a reset at the judiciary. And in resetting a system, you are not complete until the head goes. Umaru, and to be very candid with you, and I support Asiedu, my brother, that the president didn't break any law. It's true, he didn't break any law. But there were laws that were fought and had to be removed because not every law is moral. In fact, as we speak, this same government is working on a document that will make it more difficult to remove a Chief Justice. Do you know why? They themselves have assessed what the 1992 Constitution says you have to do to remove a Chief Justice. And in practice, it is very easy. In fact, someone said it's easier to remove the Chief Justice than even the director of a hospital. You know why? How do you start? You need a petition from any citizen. I can call a friend. In fact, the party secretary give you the draft. You don't even have to write it. Sign and give it to Jubilee House. And Jubilee House gives you a Council of State. If you're a practicing politician like myself, check how Council of State, the formation.
90%.
My brother, if you are a practitioner, not a theorist, the Jubilee, at any time, the Council of State we have in Ghana, 80 to 90% are friends, parties, or party people of the sitting president. Not by his fault, but by arrangement. And then when these your parties, if they get a signal, if I say something to you that advise me, and you know where I'm going, would you come and tell me that go the opposite direction? They told the president what he wanted. They gave him what he wanted. And guess what? When he now received what he wanted, the committee is forming is not by an independent commission, counsel, lawyer. He, the president, the committee, it will say choose one ordinary member of the public, and he chooses. How do you think he chose it? The person will not be a stranger. The point I'm making is that although the thing is fitting into a legal framework, it can be used for assassination. And that's what happened.
But it's not the fault of the president.
Oh, that's why I tell you that legally you are upright.
Yeah.
But in terms of the effects and what you wanted to achieve, and why is it that NDC is saying they want to change how they want to do an amendment so that next time a future CJ cannot be removed unless you go to parliament.
Because they brought the constitution.
You don't get it. It's an admission that the one now, which they actually, and you know the interesting thing, what is funny is that politicians were very funny. They are saying that this their new recommendation should be used in the future, not today.
No, but laws are not retrospective.
I know, but because they've not yet removed, at the time they were tabling this, they have not removed Tokono, so they could have passed that law so that it starts with Tokono, so that they come to parliament and get a vote. You know, so long story short, look, I'm a practicing politician. A lot of things go behind the scenes. When Tokono was removed, it did a lot of it spoiled a lot of things for this government, not on the open. Like I said, diplomatic missions send cables. So cables will go that, look, this is a president who has overwhelming majority in parliament. He controls the legislature. In fact, almost everything he wants will pass through the legislature. He is the head of his cabinet, so the executive is in charge. And then although he acted legally, he engaged in an activity. An activity was sparked, if not by him, that needed his blessing, and has led to the removal of the head of the judiciary. And the new person that came didn't come from a committee of independent assessors. It is a nomination from his office. Such a cable sends a signal that you might be running a country. And you know, one of the things about investment, an investor can have an issue with the government. Their only security and safety is that the judiciary they are going to is not like Parliament of Ghana. So immediately you are an investor or you are dealing with a government and you know that the head of the president controls or more or less has influence on all. Your rating is some way. Okay. And I suspect that might have now led to we having a process where people are looking at the merits of people's issues and not just the fact that they've started the process.
You think that you think that Jean Mensah and Kisi are not going because of diplomatic cables?
I'll just make a statement that, to be honest, with what I've experienced with Jean Mensah, I was on the entity tender committee of the EC when I was in parliament, representing the minority caucus. Look, it's politics that makes people write letters and say that remove the woman. Anybody dealing with her, not based on the history. Some have never forgiven her because she came because Charlotte was removed. Jean has had no hand in Charlotte going. But some have never forgiven her or liked her just because she inherited the seat from Charlotte. And so, like I'm saying, if anybody is being objective in this country, even MPP NDC, and we are looking at her behavior, her works, and not where she's coming from. Look at what happened to us in Asin North. NDC's fears should have ended in Asin North if it's not some intrinsic bias against this woman. We were a sitting government. We went to a by-election in a constituency that was like it could change. We used to have that seat. And Jesse Kwesi came for it. Are you getting it? This is a seat that can switch. We had the state powers. And you had an electoral commissioner that conducted an election under us. A seat that we could have tried to use things to do. And I'm coming. And the victory was overwhelming. Listen, no, forget about the cameras. The victory was overwhelming. You beat us with us holding all the tools of state. With this woman as the conductor. Why do you still say that you want a head?
Because Charlotte Osser was there when you also won in 2016.
You don't get beyond even Charlotte. Then you came to the main election. This woman and a team conducted an election where the processes were so efficient and transparent. Get it all. That within 8 hours, the leader of the opposition, not 24, the leader of the opposition, the other contender, who was actually part of the main government, comes and says that by my own tabulation, not even from the EC, the process is so efficient and transparent that by my own tabulation,
I have lost.
Had it not been for an intrinsic bias, and I'm saying intrinsic, it means it's a bias that is so deep. Why would you still go like, I want the head of this woman? And again, the last one. The last one. Look, let me say this, that going forward, all this work that was done in this constitution, some basic ones should come up for us to vote and change quickly. Otherwise, we are beating around the bush. The head of the police, the head of the judiciary, the head of the electoral commission should never, I repeat, should never be appointed by, or more or less suggested by a president. When the 92 did it, it made sense because we're looking at cohesion over development.
We have
after all these years, we have to move.
Dr. Naba.
I think what they say about Mensa, frankly speaking, I think what the president did was not against the constitution. Everybody knows that. Whether it favored him, whether it's immoral or not immoral, it was within the constitution. That's what I would say. But Jane Mensa, actually, one thing I didn't like about her, and I still don't like it, is that he left a whole constituency without the right to vote. Yes, to me, it was against the constitution. But I'll tell you, the same man who sat to see to the removal of Otukono is the same man who sat to say these people shouldn't go. So the investors should have that confidence that JM didn't appoint somebody to be bootlicking him. He appointed a man to be of himself, and that man is of himself. So they should have confidence in Ghana.
Thank you. 30 seconds, Andrew. And
just to say that I stand on all fours with what Oko Boy said.
You're supporting him.
And then I'm then questioning him.
Okay.
So why is he where he is? He should be joining us. Because everything he said is in our GTP.
Okay.
And also to add that, as in to add to what he's saying, by what he's saying, then do we even need the Council of State? Because the UP was proposing that we should scrape the Council of State and have a second chamber. And that second chamber, that will be a non-partisan chamber.
Okay.
Chamber would then be making those appointments. So the head of the police, the head of the judiciary. So I mean, all these wide powers that we've given to the president, powers that were abused by Nebu. You understand?
Who is Nebu?
No, you know Nebu. You also mentioned Nebu.
In the Bible.
No, Nebu. Nanadu. You know Nanadu.
It's okay. Leave it. Let me hear Dr. No. You are overruled. You are overruled. Dr. Nebu. Sorry, Dr. No. Dr. Norman.
Anyway,
if you can do 30 seconds for me,
sure.
My director is saying.
I think under chaos theory, everything that we have said here all goes to responsible government.
Yeah.
And so I think going forward, we should stop the politicking. As a lawyer, when I read the decision that came out in denying the removal of these elements, I felt like the same justification can be used for Tokono as well.
Okay.
But, you know, in every political situation, whether it's Ghana or the USA, the law is the law, but the law always follows the politicians.
Okay.
And so they have to be more moral and responsible to we, the people.
Thank you so much. That's Dr. Norman. Franklin Kujo, unfortunately, I'm told that you're back online, but I don't have time to engage you any further. I know you would have loved to speak on SAL. But thank you so much for understanding. That's Franklin Kujo, Imani Africa, joining us. Dr. Kwame Esedo Sapon with CDD. In studio, I had Dr. Bernard Okoboy of the NPP, Dr. Thomas Anaba of the NDC, Dr. Andre Apia Dankwa of the UP, Andre Apia Dankwa, lawyer of the UP, and Dr. Ishmael Norman, a security analyst. I am Umaru Sanda Amadu. We'll be back next week, Saturday, on The Big Issue. Thank you for staying with us.